Good morning, everyone. So today we're going to look, just pull up our file here. Today we're going to look at breast cancer and lung cancer. So if we're going to first start with breast cancer, we're going to look at a medical animation video. It's a short one, a few minutes. And we will look into treatments, from direct treatments to supportive treatments in TCM for breast cancer. And finally, we're going to look at a longer video on Qigong for breast cancer from Jerry Allen Johnson. And then after, we're going to look into lung cancers. So let's start with the breast cancer first. Let me just post the link here. Let's have a look at this short video describing the breast cancer.
You or someone you care about may have been recently diagnosed with breast cancer. This video will help you understand what breast cancer is and how it affects your body. The breasts are a pair of organs that sit directly under the skin on your chest. On the outside of the breast is the nipple. The darker circle of skin surrounding it is called the areola. In women, breasts are made of fatty tissue, milk-producing glands, and tubes called ducts. A large network of lymph vessels and lymph nodes sits in and around the breast. Fluid from the breast drains through the lymph vessels into the lymph nodes. If the fluid contains harmful substances, such as bacteria or viruses, immune cells inside the lymph nodes attack and destroy them. From there, most of the fluid passes to lymph nodes under your arm, then to other lymph nodes and vessels emptying into your bloodstream. Most breast cancer starts in the ducts of the breast, but it can grow in any part of the breast. Here, cancer cells form from duct cells lining the ducts. They can grow and multiply to form a cancerous tumor. Over time, the cancer cells can spread through the lymph nodes. The following may be signs or symptoms of breast cancer. Note that these signs and symptoms are not all-inclusive. During a routine breast exam, you or your doctor may feel a small, hard lump in your breast or underarm. In addition, you may have some liquid coming out of your nipple. Or you may see dimples in the skin of your breast. Your doctor will use certain terms to describe the progression of your cancer, called staging. Staging for breast cancer is complex. The following staging descriptions are meant as a general overview and are not all-inclusive. Stage 0 means abnormal cells are found, but have not spread beyond where they started to other tissues in the breast. Stage 1 means a tumor smaller than 2 centimeters within the breast tissue. Stage 2A means the breast may have cancer in lymph nodes in the armpit, or it can be a tumor 2 centimeters or smaller with cancer in the armpit lymph nodes. Stage 2A can also be a tumor between 2 to 5 centimeters with no spread to the lymph nodes. Stage 2B means the breast may have a tumor between 2 to 5 centimeters with cancer in the armpit lymph nodes. Or it can be a tumor larger than 5 centimeters with no lymph node spread. Stage 3A means the breast may have any size tumor with cancer in the armpit lymph nodes. or it can be a tumor larger than 5 centimeters with cancer in the armpit lymph nodes. Stage 3B means the tumor may be any size and cancer may have spread to the chest wall, the skin of the breast, and/or lymph nodes in the armpit. Stage 3C means the breast may have no visible tumor or any size tumor with spread to the lymph nodes in the armpit, breastbone, or around the collarbone. Stage 4 means the cancer has spread to distant organs. You may be wondering how you got breast cancer. While it's impossible to predict exactly who will get breast cancer, there are some things that can increase your risk. Being female, increased age, taking hormone replacement therapy, having your first child after the age of 30, exposure to chest radiation, and a family history of breast cancer. This list is not all-inclusive. As you deal with a diagnosis of breast cancer, continue to talk to your doctor and your cancer.
Okay, so that was the introduction to medical animation video to the breast cancer and progression and staging. Staging, as you saw, is exhaustive. It has from 0 to 4 levels, with some have sub-levels. Let's have a look now at our textbook. So we know that breast is fairly common, unfortunately, malignant tumor in mostly in women. Certain amount of men may end up with breast cancer as well, but it's basically predominantly discovered in a female patient population. Early discoveries means that it could be treated more successfully and slow down progression. Later discoveries past stage 3 and then stage 4 often does not have good prognostication. So as we saw from the video, there are various clinical manifestations. Often patient may notice ongoing tenderness. Let's say while they're showering and washing their breast, they may notice they have certain nodulations or mass palpable that when pressed may give them achiness or pain. They refer or stays in the same area. Occasionally, female patients may also report discharge that has a certain odor, and there's a clinical term peau d'orange. So the nipple gets really dark orange, and the discharge is fairly smelly. And sometimes we have wrinkling of the skin and discoloration of the skin. And so, but most of the tumors start growing around basically milk ducts and nipple and alveoli area. So further, obviously, stages means there's more physical changes, there's more discomfort. And so etiologically and pathologically, Chinese medicine over the centuries developed their own understanding of the breast cancer. So namely, we're looking at the few organs in associated channels, so liver, and the stomach, and of course certain extraordinary vessels like Chongmai, trusting vessel, and Renmai, and generally certain levels of the qi in the body. Again, namely, we're looking at the Jing qi, weakness of overall Raijia qi or Zheng qi, and then other pathological directions, for example, like emotional and stress-induced factors that over the time affect liver, spleen, kidney, Chong and Ren, and other vessels, and eventually pathological toxins build up in and around the chest area, causing malignancies. So we're not talking about benign growth here, which is common as well. We're talking about malignancies. malignant growth. External factors could be also, let's say, respiratory disorders that are poorly healed and they stay as a latent pathogen and they block nearby lymph nodes, setting a stage for future malignant growth. So when we look at direct treatment, which here in Ontario we rarely do, in part because of the way the health system is set up, most of the people go directly to a family doctor, then specialists, oncologists. They'll go through a series of assessments, so from regular assessments like palpation by a gynecologist or gynecological oncologist, and then they'll order the blood test, imaging, and then at that point they will conduct the staging. They'll discuss the nature of the growth, often declaring it malignant from the laboratory testing, and then they'll discuss relevant treatment protocols. Depending on the size and the stage, you may go from a surgical approach where just a partial part of breast is removed, lumpectomy. So basically, tumor is removed and maybe nearby lymph nodes, to either full breast or both breasts. So mastectomy is done, so surgically, and then that may follow with radiation or radiotherapy treatments and or chemotherapy. Additionally, they may also use the targeted therapy, so hormonal therapy, and at that point they'll stage the long-term survival rate. So usually 5 to 10 years. What is the percentage? We rarely treat it directly. In China, they treat directly because patients may go to TCM hospital. We usually treat here in Ontario in supporting role. So let's look at the direct treatment. So we're looking at the first pattern, discussing liver depression and liver Qi stagnation. So a patient presents with firm lumps in the breast with sensation of distension and pain, but without any change in skin color in and around the breast and alveolar duct. Patient often is emotionally affected. They are partially feeling melancholic, depressive, chest oppression and is present, and they describe feeling like someone is sitting on their chest. Occasionally they go in more reactive moods, so from depressive they go to irritable, reactive moods. They may report bitter or metal taste in the mouth, so acid reflux. They may report, for example, because of acid reflux, the sore throat or difficulty swallowing. When we generally look at the tongue, tongue looks pale, dull, with thin yellow coating, sometimes thin white coating. Pulse is wiry and tready, so irregular. Treatment principle here is the dredging the liver, regulating liver Qi, transforming phlegm, so as a growth, and dissipate the lumps. So one of the main formula that they would start with is the harmonizing formula, so Xiaoyao San or Free Wonder powder, also known as Bupilarum and Dangwei. And so this formula is also, of course, modified further. And here we see extensive modification. Typically, formula may have 4 to 6 herbs. Here we see it like almost a double. So, so this formula regulates the liver function and how the liver processes the blood and basically how it regulates pH and blood chemistry. So in this formula, we see that Bupilarum, so Chaihu, is one of the main herbs, even it's not the largest as far as dosing, and it's processed, it's stir fried with the vinegar. So to open up basically better flow of blood and allow hepatic cells to purify the blood chemistry. And then we see some blood tonics added there, like Dangwei and Bai Shao, white peony, right? And other herbs that are there to support liver functions, namely liver production of enzymes that thin and thicken the blood. So anticoagulant, coagulant enzymes, as well as some of the detoxifying lymph activating herbs like pugong ying, so like dandelion and others who work on toxicity. Next pattern that we're looking at is a phlegm damp due to spleen qi deficiency. So often we have a patient who may be constitutional through lifestyle, prone to spleen qi deficiency, and eventually interstitial fluids thicken into dampness and further down the road into the phlegm. So patient reports firm and uneven lumps in breast and axillary region. There's this sallow yellowish complexion that it's not jaundice-like, but the person has this yellow kind of tinge to their complexion. Patient presents physically and mentally fatigued with problems with microcirculatory exchange in hands and feet, so cold hands and feet. Again, chest oppression, stomach distension, low appetite, low energy, usually loose stools to diarrhea. Tongue is pale with the teeth marks, sometimes swollen with white or greasy coating. Pulse is generally slippery, maybe wiry, and on a weaker side, so it's slower. Treatment principle obviously is to fortify spleen, reduce spleen qi deficiency, and then thin the phlegm down, so transform the phlegm into dampness, so it could be dealt with through diuresis, through moving it out through sweating and urination. Of course, the other part of a treatment is to focus on softening hardness, dissipating the lumps or masses. So a formula here that we see is a variation of Liu Zhenzhen, so 6-gentleman decoction that's augmented with Aucklandia and ammonium, so it's Changsha Liu Zhenzhen with Jiejian, with modifications again. We see the spleen qi tonics prominent in the first part of our formula, and then we see the phlegm thinning herbs as well, so they move the phlegm from thicker to thinner, forming a fluid like dampness. And then we see lymphatic and antitoxic herbs as well there. So again, fairly noticeable syndrome in ERT type, constitutional ERT types, female patients mostly, but occasionally male, where phlegm through long-term turning to malignancy. Next pattern we're looking is a disharmony of the Chong and the Ren vessel. So we have firm lumps in the breast, they're painful under pressure, pain may refer into nearby area. Patient has a history of irregular menstruation. There's aching and limpness in the lower back and legs. There's generally distension around the breast before menstruation. There's this sense of heat, almost like hot flashes in the chest, palms, and so what we call 5 centers, heat and sweating. So there's dehydration upper jaw, so dry eyes, dry mouth, dry hair, dry sort of skin in a facial region. So when we look at tongue, it's pale and thin. Basically may have some thin white coating. Pulse is wiry, tready, irregular. When we palpate it, you've noticed the blood is not moving in a smooth and even way. So slippery, maybe tready as well. This pattern often occurs when we see a damage to blood, so multiple miscarriages, or maybe loss of blood to surgery or something like that. The blood was previously damaged and it set the stage for future malignancies. So treatment principle is to harmonize both Chong and Ren as 8 extraordinary vessels, enrich the liver, supplement the kidneys. So they use the Riemannian 6 formula with modifications, so Liu Wei Di Huang Tong Jie Jian. So this yin tonic formula is used to change the chemistry of the blood and basically allow better flow of a reservoir like vessels Cheng and Ron, right? And delivery of fresh alkaline blood into the area. So we see that in the first group of the herbs, we have kidney yin and yang tonic herbs. In a second group, we have anti-inflammatory herbs that calm and reset the blood chemistry from acid to alkaline. Then we have blood tonics, again, Dang Wei, Bai Shao. And then we see the herbs that focus on liver, qi moving freely, and the last group deals with, again, masses, right, that are palpable. So the last syndrome that we're looking in this page is accumulation of stasis and toxins. So here we have a collapse of lymphatic system. So we have a patient who reports the firm and immovable lumps in the breast with cessation of burning, heat and pain. Skin is lumped, dull, maybe purple, and has indistinct border. There may be ulcerated swelling, like upside down flower with oozing or foul-smelling blood or pus. Patient is irritable with dehydration, so dry mouth, afternoon fever, shortness of breath, smaller volume of urine that is red and smelly. Constipation, tongue is dull red with stasis marks of purplishness and yellow coating, pulse is slippery, rapid, wire, and rapid. So treatment principle at this stage is clearing heat, relieving toxicity, transforming blood stasis, and dissipating the lumps. So this is often stage 3 and on, stage 4, right? So here they're using 2 formulas. So you know when the clinicians are using 2 formulas with additional modifications that this is not a good prognosis. So we have peach kernel and safflower 4-agent decoction, so Si Wu Tang that's enhanced, so Tao Hong Si Wu Tang, and it's combined with Jin Yin Hua Gan Cao Tang, so honeysuckle licorice decoction with Jiejian with modifications. So again, a combination of these formulas are focusing on changing blood chemistry, making it more alkaline, moving it better to reduce the pain. Then we have toxic, basically antitoxic or detoxing herbs that activating lymphatic system and the liver. And then we have small amount of qi tonics as well to boost overall qi. And the last group also deals with masses and bleeding and detoxing abilities. And so the final syndrome here is depletion of qi in blood. So this is a late stage breast cancer. In TCM, it's called Ruyang or mammary rock because there are lumps there, they're ulcerated, there's lots of discharge, there's a false smelling, exudate. There's general deconditioning of the patient. Patient is very much physically and mentally fatigued. Whole body feels and looks like one big sore in some way. They can't eat, they can't sleep. Often this is like basically in a Western medicine, considered a palliative stage of the care. We see this in patients who don't have adequate access to healthcare. So they wait till the last stage and then in desperation they try to access the care. So because patients' zheng qi is depleted, they can't sleep, they can't eat, the condition is advancing very aggressively. So treatment here is palliative at this stage. So supplementing qi, nourishing blood, and trying to relieve toxicity, so slowing down progression and making patients comfortable. So again, we have 2 formulas here: the decoction for augmenting qi and nourishing yin qi, so nutritive qi, combined with perfect major supplementation decoction. So we have Yi Qi Yang Rong Tang and Shi Guang Dabu Tang Jiejian. So idea is that we try to boost the body's ability to stabilize itself and to some degree fight the last stage of the condition. And trying to make patients as comfortable as possible and basically stabilize their mood and physiological functions, buying them dignity to endure through this unfortunate stage. So Chinese medicine very well integrates with Western medicine. So often we're in a supporting role, supporting overall qi, sheng qi, reducing side effects of post-surgical stage radiation and the chemotherapy. So we're going to look here at surgery and post-operative period. So this is generally what we are involved here in Ontario in the West, where patients are already diagnosed, they undergo first level of treatment, which is usually surgical, and then usually they see us post-surgically because there are a fair amount of side effects, right? So then Chinese medicine in combination with the herbs, external treatments, acupuncture can assist. So formulas that we have here are hospital proprietary formulas. So they often don't have a name. They may be called like post-surgical formula 1, 2, and 3, for example, on an oncological department. And physician may just write them and send you down to a herbal pharmacy in usually first floor of the hospital, and then they'll create this, and they may even decoct it for you and give you those plastic bags to take it home, refrigerate, and drink. Again, at this point, post-surgically, we have swelling, we have redness, we have pain, we have decrease immunity response because surgery itself is in some way trauma. And so treatment principle is to boost the qi and blood, fortify spleen, and boost the kidney. Spleen as the post-heaven and the kidney as the pre-heaven organ, right? So often we may also use the topicals if, for example, the surgical site is not healing as quickly. So we may apply some external topicals that basically speed up the skin healing and the area that was stitched, right, and reduce maybe scar and tightening around the skin itself. Dietary approach is also very important post-surgically, where medical porridges are prescribed, often or congis that enhance with the herbs. They're well cooked, so they're easily digested. And the herbs in them generally focus on opening the appetite, absorbing better and duodenal part of a small intestine, boosting the qi and the blood, and helping patients to recover before they probably go for second stage of treatment, which may be radiation or chemotherapy. So we're going to look at the next stage. So that would be radiotherapy or radiation, where typically patient will go to 10 or 12 sessions of either external beam that narrowly focuses on irradiating the area and preventing any remaining malignant cells from multiplying. There's also internal based radiation when the small amount of radioactive material is left next to surgical site and later removed. And so, of course, radiotherapy is incredibly invasive. It has severe side effects. So it may cause respiratory infections, heart issues like palpitations, pneumonia, digestive issues. So Chinese medicine works really well to offset these side effects and help the patient make it through this second stage of this invasive treatments. So here we see internal treatment through herbs, where there's a severe damage to, again, to fluids. So we have burning, heat, and pain in the skin area that it's irradiated. So overall dehydration, because radiation creates toxicity that slows down lymphatic drainage and drains the fluids. Patients often are very weak, they don't eat, and that's, of course, what we want to avoid, because if they can't eat, they're not going to get better. Their immunity will be suppressed, and then malignancy may return. They may be constipated, they may have urinary tract infection. So we focus on nourishing and generating body fluids, clearing overall heat and toxicity, and activating lymphatic system. So again, we have here a hospital-based formula that are prescribed with some modifications to patients. What is important to notice here is that often patients may not be able to drink this, especially here in the West, because as we know, tongue decoctions are not very attractive. They work, but they look murky, they smell kind of earthy, they taste, well, not that good. And these patients already have issues with not eating. So often, if for Western patients, I would suggest that we go with tablets. So we increase the effectiveness of the treatment, and we improve the patient cooperation and effectiveness of the treatment. Skin damage due to radiation may be another issue that we deal in very often. So skin is itchy, it's swollen, it's red, it's basically burned by radiation. There's exudation, there's pus formation, there's ulceration. So treatment principle is augmenting qi, nourishing blood, and drawing out toxins and generating flesh. We may also use external treatment. There's a couple of them. The one that is easily acceptable to us is Qing Wang Hong, which is a general dermatological ointment, but often used for burns. And it works by generating the tissue and reducing inflammation, reducing the burning, and can be purchased easily in TCM herbal pharmacies in Toronto and around the area. So other therapies that may be used in conjunction with radiotherapy are chemotherapy, targeted therapy to endocrine, so hormonal therapies. So chemotherapy is also fairly tough with side effects, and it's usually used in a combination, and there may be, again, severe side effects. So depressed appetite, low energy, loss of hair, altered liver and kidney functions, toxicity in multiple organs from heart, kidney, liver, spleen. And so, again, this is covered a little bit more in chapter 4 that we talked about it, where treatment may be targeting some of these, whatever is prominent and becomes a chief complaint. Endocrine therapy is hormonal-based targeting therapy that is used for long term, often months and a year or years, and it may also produce a fair amount of side effects. So irregular menstruation, nausea, vomiting, poor appetite, mood swings from depressive to irritable, and others. So TCM can be used here fairly effectively to support the patients, increase the healing abilities, and work on neutralizing as much as possible side effects. So in ideal world, you would combine the TCM with the Western medicine. In China, of course, they do. Here in the West, not so much. Western medicine is still very suspicious of what we do, and they don't have a good understanding who we are. And we rarely see mainstream inclusion of TCM with oncology. Most of the time, patients come privately to us because they're desperate. They're noticing that while the treatment may be working, they're suffering a lot. So Chinese medicine generally, as we mentioned, focuses on building the vital qi, the zheng qi, increasing better detoxifying effects, so rebuilding the lymphatic drainage, reducing overall toxicity, increasing circulation and quality of qi in blood, helping with the appetite, with sleep, with the pain, right? So obviously other therapies can play a significant role. Nutritional or dietary medicine can play a role. Of course, we need often someone to cook for patients because patients are no shape and way able to cook. So often that's a family member or maybe a personal support worker, PSW or someone. And so nutritional value of this medicated meals can steadily increase positive response of patients and reduce the toxicity and side effects of post-surgical stage chemo, radiation, and targeted hormonal therapy. Qigong can work really well, and we're going to look into that in a minute or so, where we're going to have this a presentation of some basic Qigong exercises that could be done by known expert on Chinese medical Qigong, Jerry Allen Johnson, where again, some basic Qigong exercises can significantly improve the short and long-term recovery rate and survival rate as well in the patients. So let's now switch to Qigong therapy, and then we're going to have a break, and then we're going to switch later to the lung cancer. So let me just ease out of here. And so this is proprietary video. I don't have a link for you, but we're going to have a recordings. So please download recordings of this class. So you have a record of this excellent presentation on medical Qigong therapy. So here's the Jerry Allen Johnson presenting on treatment of the breast cancer through Chinese medical Qigong therapy.
The purpose and goal of this tape is to offer a complementary alternative approach to healing in the treatment of breast cysts, tumors, and cancer. These particular exercises are used in China at the Xiyun Hospital in Beijing, as well as the Haidian University Medical Qigong Clinic in Beijing, China. I have used these prescriptions and prescribed them to my patients with extremely successful results. And that is why we're offering them to the public in hopes that the public may benefit from these exercises. China has been using medical Qigong as an alternative approach in the healing modalities of treating cysts, tumors, and cancer for many years, and it is now offered to the American public. In traditional Chinese medicine, we look at the formation of tumors a little bit different from Western medicine. When I first went to China in '93 to finish up on my internship, the reason why I went to China is I had spent 18 years in the clinic, and most of the tumors that I was dissolving would grow back within 3 months, which was quite upsetting. So when I went to the Shiyun Hospital, I had to go before review boards, and they let me in, and I was the first foreigner that they actually gave patients to, and I began my own clinical rounds. And I remember talking to a Dr. Xu, which is one of the instructors there, and I was explaining to him my dilemma. And I go, you know, after I dissolve the tumor, it grows back after a couple months. And he looked at me and he goes, oh yes, you are just like the Western surgeon. And I go, what do you mean? He goes, well, the tumors we consider flowers. And for you to cut it out, you're just popping off the head of the flower. The root and the stem of the whole complete system is there, still intact. If you pop off the flower, it's going to grow right back, which is quite true. You can dissolve tumor after tumor or surgically remove tumor after tumor, and they just grow right back. Or certain types of cysts, what they'll do is the Western physician will take a needle and stick it into the cyst itself and drain it, and it just fills back up, because the energetic matrix that supports the formation of the tumor is still intact. So he goes, what you have to do is you have to destroy the root system. If you destroy the root system, then the flower dies and it doesn't grow back. At that point, I began to look at energetic medicine completely different from any of my acupuncture experience. And so began my whole journey about treating tumor, cysts, cancer, and kidney dysfunctions that create the formation of tumors, cysts, and cancer. In a woman's body, you have something called the thrusting channels, which come from the inside of the uterus, come up, and they branch out to embrace the breast tissue, as well as circle out and go up into the side of the upper thorax on both sides. These channels are symmetrical. There's one on each side. You can see that the stomach channel goes down through the center of the nipple, down into the lower torso. The liver channels, especially the channels that are connected to the divergent channels and also the muscle channels, will come up and support the breast tissue. And the conception vessel, which starts again from the uterus and comes up the outside of the body, dividing it in two, is responsible for carrying energy into the breast tissue. So in treating the breast tissue formation, we have to look at what feeds and what supports the tissue itself. That's why we look at the pericardium, the muscle channels, which support the formation of the tumors, because the tumors are generally in this area. Now, and also the heart muscle channels. The pericardium is the cover of the heart. When you're emotionally upset, the heart and the pericardium are shaken. And so that's why the prescriptions that are given in this tape deal with releasing the heart and freeing the heart to break free for the stagnation, also purging heat, which is what's responsible for the liver heat rising up and causing the tissue formation. We believe that for a cyst to form, what happens is the liver heat can rise up and mix with the phlegm that's released from the stomach. And what happens is the phlegm and the heat mix together with the grief of the lung energy, which is very gelatinous in its nature, and can cause the cyst to form. And again, those are the different stages of the cyst formation. So in treating these type of cyst formations, We do specific exercises that work with the liver, gallbladder, the thrusting conception, heart, pericardium, and stomach channels. Consequently, that's why in some of the prescription sections, you're leaning back and stretching this area. Or you're doing the sounds that open up this area. Or you're doing meditations which quiet this area. And as an overview, you will see all the exercise prescriptions support the purging of energy that are trapped within these channels. Now in China, we look at the tumors and we realize that they're developed either externally or internally. By externally, I'm talking about the invasion of external pathogens, external poisons, such as toxic poison, exposure to chemicals, radiation, things of that nature. If it's internally induced, then we look at the suppression of emotions, the anger and rage that are stored in the liver, the grief and sorrow and shame in the heart, in the lungs, the worry in the spleen, and the fear in the kidneys, that all begin to add up and add to the creation and formation of these cysts. We believe that for a cyst to form, it has to first bypass the immune system. After it bypasses the immune system, it has to establish residence within the host and establish a feeding. And hence the root system is established, which supports the energetic matrix, which creates the tumor, which allows for it to be part of the body. The body then accepts it, no longer fights against it, and begins to support its growth and maturation. We look at cancer as evil embryos that are created within the host and supported by the energetic structures of the host. So in working on treating cancers and cysts and tumors, we focus on the energetic matrix that supports the creation of this cyst. Now, if we look in these diagrams, we can see in stage 1 that the cyst becomes formed. We believe that the suppression of anger and grief contribute greatly to the formation of the cyst. As the anger turns into depression and the grief turns into despair, the energetic matrix begins to finalize itself and become established. It sets itself up as an energetic flower within the structure of the tissues. In the cyst itself, if the surgeon cuts open the mammary tissue and begins to remove it, if the energetic matrix that supports the formation of the cyst is still intact, it'll just grow back. In China, we divide up the formation of tumors and the formation of cysts. We believe in certain cases that it'll come in as a cyst, and then from there it can migrate and become a solid tissue matter, and then from there form into what we call tumors. A fibroadenoma is a part of the cyst that's become solid and become a tissue mass. We believe that that is also a formation of blood stagnation and body fluids. So this would be considered more a blood, phlegm that's been heated by the toxic heat in the body, and body fluids that all of a sudden mutate into a form of something solid, where this is considered, or a cyst is considered, more liquid. You also have an intercystic papilloma, which is a cyst within a circle matrix within the body. These are two of the most dominant types of breast tumors, as opposed to breast cysts. So when we talk about breast cysts, we're talking about liquid sacs of qi and phlegm that have been heated by the toxic emotions inside, that have been created, formed, heated, supported. And this is generally in Western medicine a lot of doctors won't, they'll just ignore this. The tumor, though, however, because it's a solid tissue mass, can set the foundation for cancer. And so at this point, they look to do biopsies, and they also look to sometimes surgically remove them. This is a dissection of the phytoadenoma. And as you can see, it's a solid mass created from qi, phlegm, blood, and body fluids. Medical Qigong prescriptions use sound for purgation. When you focus on a particular area in your body, let's say a cyst formation within the breast, and you do the shang sound, it begins to vibrate the area. When the cyst establishes resonance, it also establishes an energetic pattern. This energetic pattern then becomes part of the tissue, and that's why it can continue to grow unobstructed. The sound resonation causes a chaotic resonance, which distorts the pattern. That's why sometimes the exercises may be very painful, because as the chaotic resonance breaks the distorted pattern, what will happen is the distorted pattern creates a shift, and the body has to create a new pattern. So what you're doing is you're doing the sound, creating a new pattern, and that new pattern then begins to break and tear up the energetic structure, which causes the tissues to break apart. When the tissues break apart because of the vibration, then the body's immune system in the form of the phagocytes and the hunter-killer cells come in and eat the debris. That's why there's a sound and tissue rotation, so that the sound breaks up the formation of the tumor, and then the rotation along with imagery helps the immune system to locate the energetic dysfunction. By doing these exercises, again, it brings the tissues an awakening, and through this awakening, their immune system can address and correctly attend to the formation of these cysts. These exercises are also designed to be used as an adjunct to Western medicine and the Western approach to these types of therapies. If the patient has tumors or specific types of cancers, they're encouraged to work with an oncologist so that the oncologist can monitor the progress that these exercises are having on the patient. This exercise is called the old man searching for a reflection of moon at the bottom of the tide pool. It's generally the first exercise that we give the patients. It helps them to feel their emotions. The exercise was taught to me in the early 70s. It was brought to the United States by Master Wong. Dr. Wong taught us this exercise, and he gave us a story that I'd like to share with you because it helped remind me of the exercise prescription. He said the exercise is called Old Man Searching for a Reflection of Moon at the bottom of the tide pool. And the story begins as this. There was an old man in the southern coast of China looking for sea crustaceans to feed his family. It was at nighttime, so he was carrying his lantern and looking amongst the tide pools. And he saw this beautiful pearl, and he goes, "Oh my gosh, look at the size of that pearl. With a pearl that big, I'll be able to feed my family and retire for the rest of my life." So he put his lantern down and he inhaled, and he exhaled, which is him splashing in the tide pool. Then he bent his knees and looked up and went, "Ah, it's the moon. Oh, there's no pearl." And that's how the story goes. The shh is purging the grief. The ha is the joy of seeing the moon. The ho is the anger and worry of not finding the pearl. And that helps release the toxic emotions trapped in the body. In China, patients are divided into two categories. Those patients who are sensitive to energy and energy qi emission, and those patients who aren't. The patients who aren't are given specific exercises such as soul retrieval exercises to help them feel their body and become aware of their emotions. In this particular exercise, it enables the patient to detox emotions inside that they've been holding on for many years, and then to help them feel again. The reason for this is we have a saying in the business that you can only heal what you feel. So all the exercises are geared to, number one, help you feel them, use visualization, use affirmation, and use your imagination in getting in touch with your tissues and the energetic matrix that supports the disease and also that's responsible for challenging the existence of the disease and initiating healing. Okay, so my assistant. Okay. We're going to demonstrate this exercise. Again, it's called Old Man Searching for a Reflection of Moon at the Bottom of the Tide Pool. We'll work with the posture first. And working with the posture, the feet step a little bit wider than the shoulders. The hips tuck under. You close the anal sphincter. The spine is kept straight. The tongue is placed on the fire position. There are 5 tongue positions. The fire position is the position behind the teeth in the upper palate, on the hard palate. And you relax so that what you should be able to do is put a slight compression on the shoulders and feel the pressure in the legs. So you should be relaxed enough so the whole body, the bones stack and the tissues just suspend on each other. Now, with that as your foundation, you'll lift the hands in front of you and inhale, expanding your lungs, expanding the rib cage. As you exhale, you'll bend over and you'll exhale a she sound. It should sound like this. Then you'll inhale again. Lift your arms up and imagine grasping 2 sparrows. You'll exhale going ha for half the breath and then ho for the other half of the breath. The ha sound is used to regulate and balance the heart. The ho sound is used to purge the liver qi stagnation and liver fire, and then spleen stagnation, and also resolve phlegm. The phlegm and the liver heat are the foundation of the energetic matrix that creates the cis, and that's why we're doing these exercises. The other reason is that as you begin to do these exercises, the whole sound helps to move the energy and relieve stagnations that are trapped inside the thorax in the hypochondrium area. Now, to do the prescription, you'll do 1 sh sound and 3 sets of ha ho, 3 repetitions, ha ho, and that equals 1 set. Generally, for the prescription, you do 36 sets. I'm going to demonstrate a couple sets now. In order to perform this exercise, Connie will inhale and bring her hands in front of herself and then separate. This fills up the lung area. As she exhales, she will lean over and exhale the sh sound, being careful to allow the hands to intersect out and inside of each other. Then she'll bend her knees, inhale, reach up, imagine grasping 2 sparrows with each hand, and exhale the ha sound. All the way down to the shoulder, and then the ho. And the hands will point up. Now, when she exhales the ha sound and comes down to shoulder level, the circles from grasping, imagine grasping 2 sparrows, will line up with the lung 1 points here. When she does the whole sound and she ends with the palms facing up, it will be here by the liver, gallbladder channel, and then by the liver channel. It'll intersect both channels. So we'll do this 3 times. From here, she'll drop her hands to the side, reach up again. Okay, now as she does the ha sound, as she inhales, she imagines the energy filling up the whole thorax, but she focuses specifically on the heart, vibrating from the front of the heart to the back, what we call the Shen Dao, or spirit gate of the heart. And then the other half of the breath, the whole, she will focus on the liver, the energy from the liver vibrating and purging itself from the right side to the left. Okay, again. And one last time. To end the exercise, this was one set. After doing 36 sets, then she will bring her hands by her side and perform what we call pulling down the heavens. And as she reaches her hands up, she will imagine the energy filling her body from the ground up, and then the energy in the arms melting down into her chest, and the energy in the head melting into her chest, and the chest melting down into the waist, through the legs, and deep into the ground. So there's a melting and purging action. She will do this 3 times, inhaling up and exhaling down. Now, she will stand in just quiescence for a couple of minutes. In other words, quiescence means to stand and be quiet. Wuji is a posture that means from this posture you can dissolve into infinite space. So all stress you release, all thoughts you release, all feelings you release, and you come into a quiet state of peaceful contemplation and feelings. Now, in doing the exercise, sometimes it's very difficult or challenging for some of the patients to count the 36 sets. With those patients, we advocate that you just keep a watch or clock nearby and practice this set for 25 minutes. The goal for this exercise is to purge the toxic emotions inside the internal organs and to disperse stagnations. The exercise will look like this. We inhale, exhale, inhale, ha, ho, ha, ho, ha, ho. Ha, ho. Ha, ho. Ha, ho. And one last. Ha, ho. Ha, ho. Ha, ho. And then we're pulling down heavens, inhale. In performing the old man searching for a reflection of moon at the bottom of the tide pool prescription, generally you will do it once a day depending on the condition. For cysts, we encourage the patient to do it once a day. For tumors, twice a day. For cancer, about 3 times a day. So all the prescriptions will change according to how severe the condition is, noting the fact that as aggressive as you are, the faster the results will be. we're going to do the first exercise, which is called Shang, sound exercise. The sounds are purgation exercises. They're used to aspirate or suck from the inside out. And because it's purging, the Shang sound is used to either dissolve the breast cysts, to treat breast cysts, or to treat breast tumors. I will teach that to you now. Connie? Okay. What we're going to do is the structure is the same, where you face forward, feet face the straight, close the anal sphincter, tuck the butt under, Ming Men presses back, tongue on the palate. You're going to begin by first shaking the hands, slapping them and getting them very hot. After the hands are hot, you'll place them on the breast tissue. And you'll suck the heat from the hands into the breast tissue. Close the anal sphincter, and as you inhale, imagine the chi from the hands going into the breast. Now, as you inhale, you also want to imagine divine healing, white light energy going in through the nose and mixing with this energy that comes in from the hands. So at that point, you inhale, in goes the good, out goes the bad. 3 times for 3 breaths. Inhale, exhale. Again, the heat coming from the hands and the heat from the heavens mix, and the energy from the heavens mix. After 3 breaths, you rotate from the inside up, like a fountain, moving this way and then down for 36 breaths. You'll imagine the energy that you've gathered in the breast tissue beginning to break up the cysts, or begin to change and transform and break up the energetic structure formation of the tumors. After 36 rotations, you'll pause and you'll feel the breast tissue heat, continue to heat. Then you'll go the opposite direction, going from the top down the center and rotating to the sides. 36 rotations. Again, you want to feel the breast tissue. It's not just a matter of rubbing the breast, it's feeling inside the tissue and connecting with the formation of the cysts. For those who are using this for preventative, just feel your whole breast tissue and begin to feel it resonate and just energize with the rotations. After 36 rotations, you'll pause, feel the heat come into the body, and then move your torso towards the left direction. You'll inhale, and you're going to exhale the Shang sound in a straight tone. So it'll sound like this. Inhale. Shang. So as you hold the sound and you inhale and then exhale, Shang. Very good. The most important thing is that you feel the lungs vibrate. You'll do this for 10 breaths. We'll just do one more. This sound is also used for lung disease. So in doing it, it's important that you feel the vibration of the lungs in the lung tissue, or the breast in the breast tissue. 10 breaths from the left to the right equal 1 prescription. So we're going to show that to you now. Connie? Okay. Shang. Okay, it's important to feel the sound. Shang. Okay. A little longer. Shang. Okay, one more time. Shang. And one last time. Shang. After 10 repetitions of a straight tone from left to right, you will pause, inhale, and then go from right to left with a descending, ascending tone, which will look like this. Shang. Okay, and the prescription will sound like this. Okay, 45. Shang. Inhale from left to right, exhale from right to left. Shang. Okay, two more. Shang. Shang. To end the prescription, after you finish the shang sound, you'll rub the sides of the channels along the lung and large intestine and down the gallbladder channels in your body. And that ends the lung sound of shang, to purge the lungs and also to treat breast cysts and tumors. This is the primary prescription. So for dissolving cysts or for treating cysts, generally we'll have the patients do them for about 3 to 5 times a day. For tumors, it's 5 to 8, and for cancer, it's usually above 8, more than 8 times a day. Since they're just 10 tones, right and left side, including the warm-up, it should only take you about less than 10 minutes, one session. The second sound that we use is guo. Guo is used specifically to purge the liver of anger, suppressed rage, and also toxic liver heat. The shang sound that you have been doing has been working with the lungs, and now the guo sound will work specifically with the liver, purging the liver fire and the liver heat. Also stored in the liver are the acquired emotions of anger, rage, jealousy, disappointment, frustration, irritation. The guo sound is performed as follows. While facing the front, feet in a wide channel, close the anal sphincter, tongue on the palate, Mingmen pressing back, spine straight. You will first do a prep. To prepare the liver for the purging sound, you will bend your knees, you will inhale and imagine dredging or purging the liver channel, scooping out the pathogens. So you inhale up the front of the and the inside of the legs, through the perineum and the groin, up to the hypochondrium area where the liver is. As you inhale, and as you exhale, you'll move the, imagine purging to the sides of the body and down the outsides along the gallbladder channels, along the outside, inhaling up and exhaling down. Inhaling up and exhaling down. After about 3 to 9 times, then as you inhale up, you'll go right into the hypochondrium first. You inhale, you'll twist to the left. Make sure you keep the anal sphincter closed. And remember, you have to feel the tissue area. Inhale. Exhale. Now you'll do this again for 10 breaths with a straight tone, which will look like this. Okay, bend, sink, relax, inhale, and feel. Good. After performing the guo sound for 10 times, you will pause, then shift to the right into a descending, ascending sound, which should sound like this. The exercise should look like this. When you end the guo sound, as in when ending the shang sound, you will purge the channels going all the way down and end the prescription. This next exercise is called dry crying. It facilitates the release of trapped emotions pent up inside the body for many years. If you ever watch little children cry, they shake their whole body and they travail and they cry. As they get older and they begin to reach puberty, they begin to use their neck and they seal off the crying. They do this. It's an acquired habit because this shaking all of a sudden is not acceptable. They're either made fun of by the parents or by siblings or people of that nature, and so they learn to stuff the emotions, and so the throat becomes the whole stopping ground. Hence you get plumpet seeds. In other words, liver chi traps up along with the grief and forms a knot in here, and that's what the knot in the throat is all about. But in healthy releasing, it requires the whole body to undulate. If you look at Dr. Bones here, your psoas muscles articulate from the transverse process in this back and come all the way through into the pelvic bowl, and they intersect in the medial aspect of the femurs through here. So the psoas muscles on both sides of my body are connected inside through here, and if I stretch and lean back and stretch these psoas muscles, they're also known as the emotional muscles. They carry the emotions inside the body. By causing them to stretch and relaxing, closing the anal sphincter and yet relaxing the abdominal muscles, you are able to resonate these muscles and facilitate a vibration to become released through the whole body. The exercise is very, very important in releasing grief stored in the lungs. It's very powerful and it's very dynamic. The exercise looks like this. After stepping in a wide channel, you close the anal sphincter. The wide channel is to support you from falling. Your thumb and first finger touch and you lean back and stretch. As you lean back to stretch, this opens up the lungs. Again, this is a lung purging exercise, and it facilitates the stretching of the psoas muscles here. So I'll stretch like this. I'll inhale. It's called dry crying because it facilitates the shaking of deep travail. Okay, Connie? Okay. As my partner steps in a wide channel, she will take her thumb and her first finger, form a connection. Again, this is the lung and large intestine connection, from the lungs and the large intestine going back inside her body. The lungs and large intestine in traditional Chinese medicine are connected. They are the yin and yang of the lungs. Okay, as she leans back, she'll open her mouth and like a tube breathe down the center of her body. As she begins to breathe, there you are. She begins to release and vibrate. Right, relax the nose, breathe through the esophagus. There you are, deeper, deeper. There you are. Okay, tuck the chin in, come all the way down. And as you come down, you imagine all the grief in the lungs purging out through the hands and deep into the ground. This is very important. You must end the exercise with the lungs and the imagery of the lungs pouring down through the hands into the earth. And then from there, bend your knees to come up. Now, Qigong is a skill of energy, and Qi is a medium between matter and spirit. And so in doing this, what you're doing is you're facilitating the release of years of toxic grief that have been stuffed inside your body. A lot of times in holding this posture, the patients will begin to cry and facilitate the purging, the releasing of this type of emotion. This is encouraged, and it should be continued for about 15 minutes. Now generally it's very hard to hold this posture 15 minutes straight, so we'll hold it as long as you can, then root and ground out. Then go back to the posture, then root and ground out for a period of 15 minutes. For some patients, the standing is not an option. It's very difficult for them. They either have cervical vertebra or lumbar vertebra damage or structural deformations or subluxations within the spine itself. So the seated posture is another alternative to doing this type of prescription. To perform this from a seated posture, you sit at the very edge of the chair, feet flat on the ground, and then lean all the way back, all the way back, all the way back, and let the hands separate. Open up the mouth, and again, you want to breathe down the very center of the torso, down into the lower perineum. As you breathe, each exhalation, imagine the qi melting down the arms, each arm, and flowing into the ground. So the energy is coming in from the heavens, dissolving the toxic debris within the perineum, the psoas muscles, the lungs themselves, and then pouring down, all the way down the arms, and then out into the ground. After several minutes of this posture, you will shift your weight forward, and then again place your hands on the ground and imagine the qi from the lungs, all the loose toxins pouring down the arms into the ground through the fingers and the hands and the arms, just everything melting all the way down. And then from there, shift back up and then return to quiescence. One thing about the seated posture is it's not as powerful as the standing posture. So if at all possible, you're encouraged to do the standing posture. If you're having lower lumbar problems, you can always get a weight belt. You can get a cervical collar to protect the neck, because the most important thing is stretching the psoas muscles. This prescription should be done at least once a day. For treating cysts, you want to do it once to twice a day, depending on the severity of the cyst and how many there are. For tumors, at least 2 to 3 times, and for cancer, about 5 to 8 times a day. This next form of prescription is called point therapy. This is what the patient does on their own for treating and helping to remove the stagnation inside the breast tissue. We'll begin with small intestine 3 point, which is right along here. You don't have to be specific and accurate. What you can do is just massage this whole area like this. So you take this side area and just massage. After a couple minutes, you massage the other point here. It's right along the side of the knuckles. This point is used specifically to remove rebellious qi and qi suppression within the breast tissue area. The next point is stomach 18. It's located right underneath the breast. It's used to move the qi out of the breast, again to move stagnation. It's right here. You can use the thumbs to facilitate, again, point therapy. All you have to do is find the nipple and come down and then massage the points. Next are the stomach 36 points. You can find the stomach 36 point by placing the heel of your palm on the opposite patella, and it points to the point itself. It's a little indention just below the knee on the outside of the knee. You can use this on both sides and just massage these points. Again, if you don't have to be accurate, you can massage them like this. You don't have to know exactly where the point is. You just have to know the vicinity that the point is. In Qigong, it's the energy. The energy covers a whole circumference of stimulation. What these points will do is stimulate and regulate the energy in the entire body. You can treat this point for a period of 36 breaths. The next points are spleen 6, which are on the inside of the leg. If you find your ankle bone and go about 4 fingers up from the ankle bone, it's right here. It's very sensitive points on the inside of just behind the tibial bone. What you do is you massage it this way. Again, from 9 to 36 breaths. In fact, in all these points, you can massage them from 9 to 36 breaths. After treating this point, then you can go to the other point from 9 to 36 breaths. What this point does is, again, it's used specifically for treating breast cysts and tumors. It helps to move the energy and move the stagnation along the kidneys, the spleen, and the liver channels. The next point is the kidney 1 point, which is at the very bottom in the center of the foot here. Okay, now I should be barefooted in doing this, but what I'll be doing is I'll be slapping the bottom of the foot and imagining the energy rippling up the leg and filling up my lower abdomen. So each time I hit this area, I will imagine ripples coming up and filling up the lower dantian. This supports the kidney yin and liver yin. This increases the yin in the body. So you want to start off with 100 beats and slowly increase to 300, depending on the severity of the condition that we're treating. Again, this is for tonifying the kidney yin, which will tonify the liver yin. After 100 to 300 beats on one foot, you switch and you do the same thing on the other foot. Again, I should be barefooted. The last point therapy that we give the patients is a gallbladder 21 point, which causes the liver qi to go down and to sink. The gallbladder 21 points are on the shoulders. You can treat this by just hitting the shoulders like this. After from 9 to 18 beats, or to 36, depending on what your doctor has told you to do and your condition, then you switch and you do the same thing on the other shoulder. As you hit the shoulder, it's right here in the shoulder blade. The gallbladder 21 point allows the qi that's rising up from the liver to sink and settle and purge down. The idea is to strike from 9 to 18 to 36 times depending on the severity of your condition. If you're working on cysts, hit around 9 times on each point. If it's a tumor, then go to 18. And if you're working with breast or lung cancer, then you work at least 36 times. You will repeat the prescription several times a day if you have cancer. But for treating cysts, once a day is good enough. The purpose of walking therapy is to energize the body and increase its oxygen. The lungs themselves start from the diaphragm and go all the way up an insert between the clavicle and the trapezius. If you look at the mannequin, you can observe the lungs starting from the diaphragm, ascending all the way up in between the clavicles and the trapezius. The lung channels themselves begin on the inside of the body, wrap the intestines, come up, surface, and then flow out the outside of the body down to the anterior side of the thumbs. And walking in China is really encouraged for cancer patients. So we give it to our tumor and also our cyst patients because we're just in a hurry for them to get well. Generally it takes 4 to 6 weeks to change an energetic pattern, and we see great results within that time period, especially if they're feeling the exercises and performing them on a regular basis. In walking therapy, it's important to set out small goals and then from there increase. The goal for walking therapy is as you increase more oxygen into the bloodstream, then what happens is your immune system accepts it and begins to rebuild itself, and it helps fight the cancer. So in walking therapy, we use several different breathing patterns. We use fast walking, which is for very young patients. For patients that are older, then we have them do a moderate walking. And the idea is we have them squeeze their fists as they're walking in this way. It's encouraged to walk at least once a day for 20 minutes. The purpose for quiescent meditation is to allow the body to come into a state of quiescence. This quietness allows the nervous system to settle. Once the nervous system settles down, the immune system is then enhanced. Once the immune system is enhanced, the body is able to fight disease. Now, as you breathe into a deep abdominal regulation, the tissues and cells will fill up full of more life force energy and qi. Once the body fills up full of more life force energy, then the immune system can then be strengthened. What happens when you experience stress, the body's adrenal cortex and medulla excrete adrenaline into the system, which gives you the fight or flight adrenaline. If you're not running or fighting, but you're in a very stressful job and you cannot choose those options to release the energy that's going through your system, then your immune system seeks to buffer it. If it's seeking to buffer the adrenaline, then it's not working towards fighting disease, but buffering your own adrenaline that's shooting through your system in order to sedate the system and put it back into a state of balance. So the purpose of these quiescent meditations is to allow you to come down and to relax and facilitate a stronger immune system response by allowing the stress to be abated and to allow the body to expand its energetic field and strengthen its immune system. In doing quiescent training, generally if you're doing it from a seated position, it's important for you to be at the edge of a chair, your feet flat and your knees lower than your torso. Your hand positions can either be on your kneecaps or folded in your lap. The tongue position is generally in the fire position, which is behind the teeth and the upper palate. You want to inhale and exhale from the abdomen. The visualization that you use is as you inhale, you close your eyes and imagine divine healing light coming in through the nose, coming down the torso and expanding into the abdomen. As you exhale, you imagine it settling like a quiet pool. Each inhalation, you pull the energy in and expand it in the abdomen. Each exhalation, you allow it to settle as a quiet pool. It's very important when doing this meditation to also close the anal sphincter. So it's called the lower bridge. The tongue is called the upper bridge, and both bridges must be joined in order to store this type of energy in the lower dantian. Otherwise, what happens is if you don't close the anal sphincter, the energy escapes out the legs. So we want to use your body. Consider it like a balloon. If I blow a balloon up and seal the end, the air is trapped inside. So like so, if I'm inhaling, I close the sphincter, I inhale and I expand the energy and it settles inside my lower torso. What will happen is as we allow this energy to gather and cultivate and accumulate in the lower torso, it overflows. And as it begins to overflow, it goes into what we call the 8 extraordinary channels, which are responsible for the congenital creation of the fetus. So the congenital creation of the fetus establishes an energetic foundation for all of our prenatal energy. And the prenatal energy is the foundation of our living energy, which is supported by what we call postnatal energy, which means after you're born, any type of food, drink, any type of air that you breathe is considered postnatal energy. That energy is supported by our prenatal energy, and that's what gives us balance inside our body. This prenatal energy can only be cultivated through 3 things: through prayer, through meditation, and through sleep. Prayer is when you close and connect to the divine. Meditation is when you're quiet and you receive from the divine, and it fuses with the environment and with the universe. And then sleep, of course, is another form of quiescent training, where you close your eyes and shut yourself off from the environment and enter into a state of quietness. When we were in the womb, we were in that same state of quietness, and that's why it's so essential for the nurturing of our prenatal essence. And because of this, it's important for you to find a very quiet place. This is your time, your space, and your training for you as an individual. It is essential for your energetic survival. You're as much spirit as you are emotion, as you are mind, as you are body, as you are energy. So it's important to balance all 5. And so in this quiescent meditation, it's encouraged to go for about 15 to 20 minutes a day in a quiet space to learn to quiet yourself down. This will cause the tension and the stress to abate, and it'll calm your spirit, which will calm your emotions, which will calm the mind, which allow the body its time to expand, fill up with energy, and begin to successfully fight disease. The next thing we need to talk about is diet. Diet is essential. It supports your entire mechanism as a whole. The Chinese have a saying, are food herbs or herbs food? If you're having a tumor or cancer and we begin to put you on herbal prescriptions, the diet has to regulate and complement the herbs. Otherwise, the diet will sabotage the effect of the herbs that you're taking. So it's very important that they complement each other. We try to avoid the consumption of fats, dairy products, and sweets, which lead to the production of phlegm. The production of phlegm and the liver heat is what sets the foundation for the formation of the cysts. It also sets the formation as the cyst begins to conform into a tumor, and then from there can mutate into cancer. So it's very important that the diet support the herbs, so we avoid the consumption of the dairy products, of sweets, and things of that nature. As far as being specific towards a diet, we cannot do that on the tape. There are 5 different constitutions, and each of your constitutions are different. You must get a hold of an herbalist, and the herbalist will put you on a specific diet that supports the herbs that they're giving you. If you have a cyst problem, or you're using this for maintenance, then diet is something that we take note of, but it's not mandatory. If you're seeking to treat tumors or cancer, then diet becomes mandatory. In finding an herbalist, one that's qualified, you need to seek maybe an acupuncturist in your area that is familiar with your condition. Also an herbalist that is again familiar with your condition. There are certain acupuncturists and herbalists that specialize in herbal prescriptions for cysts, tumors, and for cancer. These individuals should be sought after and given priority above other individuals of the same profession. Another thing we need to address is social oncology and finding a therapist. Finding a therapist is very important because the exercise prescriptions in this videotape will cause you to release deep-seated emotions stored for many, many years. And at that point, it's important to be able to talk and find closure in these deep-seated experiences. In China, they have birthdays where they celebrate a year of having been diagnosed with a particular type of cancer. If you were to go to a clinic in China and you had cancer, the first thing we generally do is remove you from all outside influences. You have no phone calls, no newspaper, no TV, no visitation for 6 weeks. And you're put with a group of people that had the same particular type of cancer, and they'll love and support and encourage you, and they'll share their stories with you. What it does is give the patient hope. As the patient surrounds himself with other patients who have successfully used these prescriptions to turn their situation into remission, it gives them hope. And in that hope, their strength is supported. And in their strength, then their immune system is supported. So social oncology is very, very important. It's very important to find a therapist, someone that understands you, that you can expose your heart and your deepest secrets to. If you have resistance against finding a therapist or getting with a group that will support you, maybe that's half the problem. So it's important to take a look at that. One thing we address in the social oncology is the secondary gains of the disease. The secondary gains of the disease is the hidden agendas of the disease. There are certain individuals that have particular types of cancer that habitually sabotage their healing because they have hidden agendas. Some of these hidden agendas could be they at least control their mate. As long as they're sick, their mate won't leave them. Number two, they're getting all this attention, where if they're well, then they lose the attention. And so they have the love, the attention, and the support that the disease is giving them. So we call it the secondary gain of the disease. And it's important to talk about it because if you don't disempower the secondary gains, it's very hard to have the patient change and transition because the disease has a lot of power. They're getting attention, they're getting love, they're getting validation, and they have control. So that was why in China they removed them from all outside distractions, all outside influences, and put them with a support group to encourage them to heal. So some of the manifestations that the exercises are working are vibration, heat, sometimes a sharp pain in the tissue area where the tumor or the cyst are located. These are excellent manifestations that your exercises are working. Also, emotional outbursts. Remember to seek a therapist and not to punish your mate. But as you release these toxic emotions, history of feelings will start bubbling out from you, and that again is a manifestation. You'll start feeling things. Sometimes you'll go into depression. We believe that when there's a trauma, the first two things you experience are anger and grief. And if the anger and grief aren't adhered to, the anger turns into depression. The grief turns into despair. And if the depression and despair aren't adhered to, then the next stage is indifference and separation. And after the indifference and separation, then the denial system sets in and coping mechanisms. And then from there you distance yourself from the original trauma. In doing these exercises, what happens is as the patient comes out of denial, then what will happen is they'll first experience depression and despair. And the depression will turn to anger. The despair will turn into grief. And then from there, they will then remember the original trauma. So we also look for emotional upheavals in this following pattern. It's important when doing these exercises to take your time and feel. We have a saying in the business that you can only heal what you feel. It's important that you feel the effect of the exercises on the body and the tissues. The reaction and response between the tissues and the exercises will initiate the degree of healing effect. As you practice these exercises, you will notice that lots of emotions will surface. In particular, grief that's stored in the lungs. In healing, it's important to remember that as these emotions surface, to feel and experience the emotions and to release them. You cannot destroy energy, you can only transform it. So by writing down and journaling your thoughts, you can take the energy stored inside the organs and transform it into thought and into action and purge it from your tissues. Take the anger, blame, and resentment and disperse it onto the paper. Take grief and sorrow and shame and disperse it on the paper. Then talk about fear and insecurity of these experiences and discharge it, dispersing it onto the paper. And then finally talk about the feelings of taking the responsibility for the action and deciding to release these thoughts, to take the responsibility of healing. And at that point, begin to forgive. Forgive yourself, forgive the situation, and forgive the person that caused you the pain. At that point, you take the energy that's trapped within the tissues and completely release it from your being.
Okay, so we've seen a presentation of Jerry Allen Johnson on using Chinese medical Qigong therapy for treatment of the variety of the breast cancer pathologies. So we'll take a break now, and then when we come back, we're going to address the second condition, so the lung cancer. Thank you. Okay, so we're continuing. So we looked at over the breast cancer. We're gonna now move to another oncological condition, so the lung cancer. So let's start with medical animation. I'll post the link for you in the chat area. Okay, let's look at that video.
There's one simple hearing hack anyone can use to improve their hearing almost overnight.
This animation is brought to you by the Nucleus Medical Art Library, or NMAL, where you can download this animation and thousands of medical images and videos created by Nucleus Medical Media. To apply for a free 30-day trial, click on the link in the description.
You or someone you care about may have been diagnosed with lung cancer. This video will help you understand more about lung cancer and how it affects your body. Your lungs are a pair of organs inside your chest that allow you to breathe. You inhale oxygen, which all cells need. Then you exhale a waste gas called carbon dioxide. This gas exchange happens inside tiny air sacs in your lungs. Lung cancer is a disease in which normal lung cells change into harmful, abnormal cells called cancer cells. Cancer cells multiply to form clusters called tumors. These tumors grow and destroy healthy lung tissue. Lung cancer may spread to other parts of your body through blood or lymph fluid, a natural substance that helps gather unwanted waste material from your body. There are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. They are named for the kinds of cells in the cancer and how they look under a microscope. Non-small cell lung cancer is the most common type of lung cancer. Small cell lung cancer is the most aggressive type of lung cancer. It grows and spreads more quickly. The most important risk factor for lung cancer is smoking. Other risk factors include breathing secondhand smoke, exposure to radon, having a family history of lung cancer, HIV infection, exposure to harmful chemicals such as asbestos, and air pollution. Lung cancer may have no symptoms in its early stages. When symptoms do appear, they may include chronic cough, chest pain, trouble breathing, coughing up blood, hoarseness, loss of appetite, trouble swallowing, weight loss, tiredness, and facial or neck swelling. If you have lung cancer, your doctor will need to determine the stage or progression of the disease to help plan your treatment. Non-small cell lung cancer has many stages. In the occult stage, cancer cells are found only in lung fluids. In stage 0, abnormal or cancer cells are found in the lining of the airways. By stage 1, a small tumor is found. Then in stage 2, the cancer has grown or spread to nearby lymph nodes or non-lung tissues. In stage 3A, the tumor has grown to any size. In addition, cancer is found in lymph nodes on the same side of the chest or in nearby organs. Stage 3B is similar to 3A, but in 3B, cancer is found in lymph nodes on the opposite side of the chest. Cancer may also be found in lymph nodes above the collarbone. In stage 4, tumors might be found in both lungs. Additionally, cancer may have spread to distant organs. There are fewer stages for small cell lung cancer. In its limited stage, cancer is found in one side of the chest only. In the extensive stage, cancer has spread to the other side of the chest or to distant organs. As you deal with a diagnosis of lung cancer, continue to talk to your doctor and your cancer care team.
Okay, so we're going to look at two more videos that deals with a bit more general terms on how to deal with overall cancer through TCM, and how does the TCM deals with basically side effects of the radiation and chemo. So I just posted the first. I'll post the second link for those two. And so these two videos are produced by Hong Kong Baptist University Faculty of Chinese Medicine of their degree program in Hong Kong. So let's have a look at how Chinese medicine deals with the cancer itself.
歡迎大家收睇浸大中醫在線。今日請嚟徐海教授同我哋講解下中醫係點樣治療癌症嘅。癌症係香港頭號殺手，坊間流傳唔少謬誤同埋偏方，邊啲係真，邊啲係假呢？咁就要請教下徐海教授啦。徐教授，中醫係點樣理解癌症嘅呢？
中醫對癌症的認識，實際上早在2000多年前，《黄帝內經》的時候就已經有所認識。那個時候不叫癌症，叫做瘤。真正中醫把它稱作癌呢，是從宋代開始，主要是指生長在體表的比較堅硬的、難以醫治的這一類的，我們現在叫做惡性腫瘤。實際上，老百姓把所有惡性腫瘤都稱作癌症。癌症是惡性腫瘤當中的一種，有一些惡性腫瘤呢，老百姓比如說叫做血癌、骨癌這一類的，我們在專業上不稱為癌症，比如白血病啊、骨肉瘤這一類的。那麼現代中醫對癌症的認識呢，和現代醫學是趨同的。那麼現代醫學的癌症呢，實際上是所有惡性腫瘤當中的一種，老百姓呢常常稱為癌症。那麼實際上除了癌症以外，惡性腫瘤還包括像淋巴瘤、血液系統腫瘤，像白血病，像這個軟組織腫瘤、脂肪肉瘤之類的，老百姓呢，通通呢都稱為癌症。那麼癌症呢，現在中醫的認識呢，主要是生長在體內的或者體表的，難以醫治的，會傷害人的正常的組織結構、生理功能，而且不受控制的生長，而且還容易到處轉移。那麼這一類的呢，中醫也可以說現在都稱為癌症。
咁一般嚟講咧，癌症患者都會接受啲現代醫學治療，例如放療、化療咁樣啦。咁中醫喺治療癌症有咩優勢咧，同埋有咩目的咧？
癌症病人呢，大多數在早中期都會接受現代醫學的治療。早期的一般會採取手術的方法，那麼不能手術或者手術適應症不是很強的，那麼現代醫學西醫呢可能會給他化療或者電療。那麼中醫對緩解化療、電療產生的這個不良反應對人體的傷害是有優勢的，這是一個方面。那麼改善他的生活質量，減輕不良反應。有一些癌症病人，他西醫沒有辦法治療了，比如說非常晚期的，或者是治療以後復發再治療無效的，或者是一些年紀非常大，80幾歲了，不能耐受現代西醫方法治療的。那麼這樣呢，經常會來找中醫治療。中醫藥治療呢，可以改善他的生活質量，對患者生命的延長是更加有幫助的。
咁癌症患者喺邊段時間接受呢個中醫治療係最好嘅呢？
癌症的最開始發現，也就是早期，雖然我們強調是以西醫手術治療為主，偽手術期的中醫藥治療也非常重要。 那么在癌症化疗期间、电疗期间，也可以配合中医药治疗。刚才已经提到，有一些癌症不适合做手术或者化疗、电疗了，那么也可以中医药治疗。在临床上，我们经常碰到这样的患者，比如说准备手术了，在手术之前呢，现代医学检查呢，发现有贫血了，或者他的心肺功能状态不太好了，那么经过中医药治疗以后呢，使他得到改善，就能够更好的接受手术。有一些患者手术以后会产生一些术后的并发症，那么经过中医药治疗以后呢，也可以使这一类的并发症呢尽快的恢复。这个有的时候呢，被老百姓或者西医同行难以理解，经常会被告知化疗期间呢，不要吃中药。实际在这里呢，我要详细解释一下，在化疗期间服用中药呢，对化疗的病人减轻不良反应，帮助他更好的完成整个西医的化療治療計劃，是有非常大的幫助的。
徐教授，剛才你講開化療啦，咁化療患者咧係咪應該留喺屋企唔出街嘅咧？
要根據具體情況。化療，你看西醫有的病人就在門診化療，化完療西醫觀察一段時間以後呢，他就可以回去了。這個過程都要出街的，所以病人化療以後呢，他的身體狀態呢，往往會受到影響。要假設他的身體狀態還可以，不要到人多的地方，到人少的地方，像郊野公園啦、海邊啦，去活動活動都是可以的，並不是說他絕對不能出街的。
咁另外電療咧都好一個好常用嘅治療方法嚟咧，咁但係啲人擔心咧，電療之後咪將輻射帶翻屋企嘅咧會？
這種擔心實際上是有點多餘，沒必要，因為我們知道電療所這個使用的西醫電療所產生的是X 射線，也叫電子射線，它是在機器打開的時候呢，機器的運轉，當然這個機理很複雜了，它會產生 X 線，對腫瘤部位進行照射，那麼直接殺死腫瘤細胞、癌症細胞。那麼輻射進行完了以後，機器一旦關閉了，就沒有輻射線呢在人體內存留了。那麼這個時候病人回家呀，或者在朋友之間呢，互相交流是沒問題的。
咁中醫分呢個癌症患者咧，主要有咩症型嘅咧？
不同的腫瘤可能有不同的症型。常見的症型從實證的角度，比如說常常會有痰，中醫叫做痰瘀互結、痰濁等等、痰濕等等。那麼還會涉及到淤血，淤血呢，淤血阻滯經絡啊，甚至形成呢淤血塊，引致疼痛。那麼中醫還會有實證，還會有濕熱這一類的症型，濕熱結聚。尤其香港的癌症病人，由於體質的關係和香港地域的關係，濕熱的症型就比較多見。實際上這些症型有可能是互相混雜出現的，比如說痰和淤血的，我們叫痰瘀互結；痰和濕熱的，我們叫濕熱痰濁、濕熱痰瘀等等。這是實證的比較常見的。虛證比較常見的呢，比如說有氣虛、陰虛、血虛等等，往往也有的時候是混雜存在的。比如說像氣陰兩虛、氣血兩虛，氣血虛的基礎上要有偏寒或者偏熱了，那可能就有偏陰或者偏陽的不同的症型。
咁中醫治療癌症一般咩方法嘅咧？
單純是以中醫藥治療為主就有很多，比如說中藥湯劑、中藥沖劑、中藥像內地還有中藥的針劑、丸劑、散劑等等。那麼中醫藥治療呢，還有外治法。外治法最常用的就像針灸，當然主要是輔助治療，我們可以輔助西醫方法的治療，也可以輔助中醫藥的治療。
中醫治療癌症咧，有冇常用嘅藥物同埋穴位嘅？
中醫藥抗癌治療呢，是有很多的抗癌治療藥物的，一定要在中醫理論的指導下進行辨證施治。首先辨清楚它是什麼癌症，比如說肝癌， 我们清楚了，这是变病。那么肝癌呢，它的病理分型是如何的？是怎么样的？是中分化、低分化、高分化，这个都是变病。然后我们就要进行辩证治疗，它是虚症还是实症、寒症还是热症？从中医的角度，它有没有影响到其他脏腑？因为中医治疗，《黄帝内经》强调必先五圣嘛，肝有病，我们要知道它有没有伤到脾。见肝治病，治肝传脾嘛。所以呢，我们要辨清楚它有没有伤害到其他脏腑。实际上，这个就是强调中医的脏腑之间的这个生理关系和病理变化的相互影响。当然，也可以根据五行生科制化的角度来进行辩证。所以，这个在临床中医要治疗癌症，应该说是非常复杂的，而不是说有哪些抗癌的中药，我就拿来用。所以在这里呢，我就没有直接回答你有哪些抗癌中药。我现在回答你，比如说，像很多有抗癌的中药，像白花蛇舌草，那么很多人研究它可以治肺癌，可以治大肠癌。我经常在治大肠癌的时候，我会应用，因为从中医的理论指导呢，它入大肠，入大肠经。那么一定辩证的时候，它是有一定的热或者热毒的。假设一个老年气血双虚的一个病人，或者脏腑功能比较虚衰的病人，我可能不会用的。有一些人专门说中医有一些穴位是治癌症的，有一些穴位是治肺癌的，这个实际上是没有科学依据的。全身的12经脉的穴位，包括7经8脉里边任督2脉里边的穴位，只要辩证施治的基础上，我们都可以选择来应用，主要是辅助抗癌。
徐教授坊間好多人流傳咧話癌症患者咧應該咧避免進補嘅，例如唔可以食燕窩啦、當歸啦，甚至係戒糖添。你覺得點樣睇法呢？
坊間的這種傳說實際上是有一定道理的。癌症患者需不需要進補，實際上要根據癌症患者每一個癌症患者自身的身體狀況來區別對待的。假設一個癌症患者他被發現以後，他的身體非常虛弱了。那麼從中醫的角度呢，他有氣血不足，脾胃功能比較弱。那麼這時候呢，可以適當的進補，我們可以通過飲食調理來進補，也可以通過買一些藥物，中醫叫藥膳藥材的調補，或者一些這個特殊的補品，像燕窩這些。假設患者身體功能狀態允許，他能夠正常進食，能夠正常的攝取各種營養，不一定要進補的。但是有些補品呢，我們要區別對待。比如說有一些補品，它不僅僅是進補，或者它補的功能並不是很強，而是調理身體的，提高機體的免疫力啦，提高機體的抗病能力啦。比如說有些患者他會吃一些什麼冬蟲夏草啦，什麼靈芝這一類的，這個呢實際上它補的作用並不是很強，而是增強機體的抗病能力。尤其在化療期間、電療期間，或者術後化療、電療後身體比較弱，進食這些藥品是有一定的調理身體功能狀態的作用的。我不太主張患者一旦發現腫瘤以後就給他進補。我曾經碰到一個這樣的患者，1周1支金堑龜，找我看的時候，這個患者口氣很大，身體感覺到沉重，整天困頓乏力。我讓他伸舌頭一看，舌苔都黃厚膩，一說話那個口氣都熏人。哎呀，我說你這個體內的濕熱太盛了，像這樣的進補就太過了，就不可避免的，甚至刺激腫瘤生長。
而家好多婦女都會進食呢個大豆異黃酮咧嚟呢個保養身體，係咪都要注意呢？
實際保養身體，這個大豆異黃酮是非常好的，但是一旦被確診患有乳腺癌的時候，就一定要停了。但沒有證據證實大豆異黃酮可以刺激乳腺細胞突變生成癌症，但是一旦生成以後，它確實就有刺激乳腺細胞的作用，癌細胞的作用了。
咁進補都好多嘢要注意。咁對於啲癌症患者有冇啲食療上嘅建議呢？
實際從中醫學飲食養生的角度，早餐要吃得好，午餐要吃得飽， 晚餐要少吃。所谓早餐吃得好，就是营养要比较丰富，同时我们强调不要吃得过饱。我总结了一下呢，早餐要7分饱，午餐要吃得饱，不是吃的把肚子感觉到有饱胀的感觉，只打饱嗝的那种，香港话叫打 CA 是吧？嗳气中医，不是这样的饱，而是感觉到这里不饿就可以了。假设你吃的这里已经有饱胀的感觉，已经过量了，所以午餐强调呢要8分饱，晚餐要6分饱，要容易消化。
徐教授啊，對啲癌症患者有冇啲湯水去推介俾佢哋呢？
癌症的湯水呢，中醫是非常重視的，也非常多的。在这里简单推荐几种。一呢是给病人吃容易消化的，比如说我们煮些粥，像煮些山药、莲子粥了，就可以养他的脾胃。他有消化不好的，我们可以加一些陈皮、砂仁了，就可以缓解他的腹胀。有一些病人呢，在化疗期间呢，化疗以后呢，他这个精神情志也不是十分好，会睡不好觉，烦躁容易发脾气。我们在煲汤炒餸的时候，比如说我们在炒菜的时候，适当的给他炒点像百合了，就加西兰花、西芹之类的都可以的。或者用百合煮水给他喝啊，或者这个用百合來炒酥都可以的。
多謝徐海教授接受我哋嘅訪問嘅。治療癌症係一個漫長嘅過程，患者本身咧需要被積極樂觀面對，配合治療，而家人咧都需要支持同鼓勵㗎。想知道啲中醫健康資訊，就要留意浸大中醫在線啦。拜拜。
So that was the episode from Hong Kong Baptist University on treatment of different types of cancers through Chinese medicine. So we're going to look now at management side effects of radiotherapy for cancer as one of the main therapies next to surgery and chemotherapy. So let's have a look at that one.
歡迎收睇新一輯嘅浸大中醫在線。世界上有好多唔同嘅疾病，當中癌症就比較令人擔心同埋害怕。癌症之所以咁令人害怕，唔多唔少都係因為治療過程當中所衍生出嚟嘅副作用，特別係放射治療。喺消滅癌細胞嘅同時，其實我哋嘅正常細胞都會受到影響，然而出現唔同嘅後遺症。究竟中醫有啲咩調養方法可以舒緩放射治療後出現嘅副作用呢？針對癌症放射治療副作用呢個話題，我哋今日好榮幸邀請到劉宇龍教授嚟同大家分享。劉教授你好。
大家好。
想請問其實咩係放療後副作用呢？
放射治療副作用呢，它主要是跟這個放射治療的部位、放射的面積以及分次劑量、總劑量以及採用的放射治療技術密切相關。同時呢，跟病人的個體體質也有很大的關係。
咁其實係點樣分類㗎？
這樣就是放射治療副作用呢，主要是分為急性放射副反應和慢性放射副反應。急性放射副反應呢，主要是在放療後，到90天內或者叫3個月內出現的放射副反應。通常呢，在這個放療後，這個結束以後呢，1到2個禮拜，這個是最厲害的時候。那麼以後呢，逐漸減輕。慢性放射副反應呢，主要是在放療後3個月以上或者90天以後慢慢出現，到半年呢明顯加重，以後呢逐漸加重出現的這個慢性放射副反應。
咁其實劉教授，你頭先有講到急性同埋慢性嘅副作用啦，其實佢哋嘅臨床表現有啲咩呢？
急性放射副反應呢，主要是放射線對這個皮膚黏膜的損傷造成的，出現那個黏膜的這個紅腫啦，甚至乎潰瘍啦，引起局部的 疼痛、瘙痒等等。
其實中醫係點樣理解放射治療或者係放射治療後出現嘅呢啲副作用嘅呢？
中醫認為放射線是一個熱毒之邪，容易耗氣傷陰，出現陰虛熱毒的表現，表現出黏膜啊、皮膚出現紅腫啊、疼痛、潰瘍等等。
咁對於一啲頭頸部癌症嘅病人啦，佢哋喺進行呢個放射治療過後，如果出現咗一啲急性嘅放射反應啦，佢哋喺平時嘅日常生活中啊，有啲咩需要注意嘅呢？
頭頸部放療後出現的急性放射副反應呢，主要分為2個方面。第一方面呢是急性的放射性黏膜炎，第二個呢是急性放射性皮膚炎。黏膜炎呢主要是表現為這個鼻咽、口咽、咽喉的黏膜的損傷，出現紅腫、疼痛，影響飲食，這是急性黏膜炎的表現。急性放射性皮膚炎的表現呢，主要是在面頰上頸部皮膚的一個紅腫啦、乾燥、脫皮屑，這是一個。有的呢可能會起水泡、滲液、分泌物，甚至皮膚的潰瘍。那麼這是急性的放射性皮膚炎症的表現。那麼針對這個，究竟病人要注意些什麼問題呢？第一個是要注意這個保持口腔的清潔，做到起床後、飯後、晚睡前的這個用軟毛牙刷刷牙，這是一個保持口腔的清潔。同時呢，要用清水或者是蘇打水漱口，濕潤口腔。第3方面，當然飲食也要注意，就是不要吃辛辣、煎炸、刺激的食物，或者是粗的、硬的食物，這個是要注意的。另外一個呢，有些人可能進食困難的話，要把這個食物打得容易柔軟，用流質或者半流質的飲食，比較容易吞嚥。
頭先提到嘅一啲急性放射副作用啦，劉教授有冇啲藥膳可以推介俾大家㗎？
有一款比較簡單的藥膳可以介紹跟這些放療後急性副反應的這個患者嘅，主要是由金銀花15克、沙參15克、這個石斛10克、甘草5克，用500毫升的水煎煮成300毫升的水，分次飲用。可以有效舒緩這種放射治療後的口咽啊、鼻咽黏膜的一個急性放射副反應，起到一個滋陰清熱解毒的作用。
咁其實對於放射性皮膚炎嘅患者啦，佢哋喺平時嘅日常生活中有啲咩要注意㗎？
放射性皮膚炎呢，對於這個頭頸部放療的患者來講，主要是見於這個面頰部、上頸部的皮膚的一個放射性反應。那麼我們要注意呢，就是病人那個衣服的話，要穿一些棉質的、比較鬆軟的、對皮膚刺激少的開領的內衣，這樣減少對頸部啊皮膚的刺激。另外一個呢，自己要注意，就不要隨便塗抹一些膏藥啦，或者也不能在這個皮膚上塗一些這個膠布啊，貼一些膠布，這些是不可以的。當然你說病人這個出現皮膚反應也需要沖涼，但是我們建議他沖涼的時候呢，要注意那個不要塗抹一些刺激性強的這種清潔劑，要用一些像BB 用的這種清潔劑來做好清潔，保持頸部啊皮膚的乾爽清潔。當然也要注意，就是飲食方面也不要吃煎炸燥熱的飲食。
除咗急性嘅副作用啦，如果患者出現咗慢性嘅放療後副作用啦，例如係我哋嘅面肌或者係頸肌嘅纖維化，有冇啲鍛鍊可以做㗎？
對於這個面肌的纖維化，它的表現呢，主要是面頰肌肉的僵硬、緊張，影響張口啊、進食， 颈肌纤维化呢，它主要是表现出颈部肌肉的僵硬，影响颈部的活动。那么我们可以做一些这个口咽操来舒缓这个面肌紧张。口咽操的动作呢，主要是以下几个方面。第一个是张大口，你比如说连续张5次。第二个是鼓塞，就是嘴巴包一口气鼓塞。第三个呢是这个叩齿，就牙齿叩响叩齿。第四个呢是绕舌，把舌头呢在口腔里边顺时针打圈，反时针打圈。第5个呢是拉舌，怎么拉舌？不是用手拉舌哦，是用门牙咬住舌尖，然后做吞咽动作，这就是拉舌。这是一个口咽操。另外一个操呢是颈肩操，颈部肩膀操。它的动作呢主要是米字操，就是上下左右，这个左下右上，右下左上，这个米字操这个动作。另外一个是一个耸肩缩颈的动作，还有一个是扩胸抬头。第三个呢是这个双手托天，这个是颈肩操。当然还有一些按摩的穴位可以帮助舒缓这个颈部、面部肌肉的僵硬。你比如说常用的穴位呢有风池、大椎、肩颈、合谷。这几个穴位可以按摩来舒緩這個面頸肌纖維化。
咁我哋頭先講咗好多頭面部㗎啦，如果係進行咗盆腔部放療嘅患者啦，佢哋需要注意啲咩㗎？
盆腔的放療主要是針對直腸癌、前列腺癌、子宮頸癌的病人做放療，那麼它會出現一些急性的放射副反應，主要是急性的放射性直腸炎。急性的放射性膀胱炎，急性的放射性直肠炎呢，主要是表现在腹泻、粘液便，甚至便血。那么这是或者里急后重，很想急着去拉大便，但是又拉不出来，这是急性放射性直肠炎。那么急性膀胱炎呢，主要是在放疗后大概2到3个礼拜开始出现，它的表现呢，主要是尿频、尿急、屙尿疼痛。那麼這是一個，或者是小便不利、不順，這是急性膀胱炎。
咁對於盆腔放療後出現嘅一啲放射性直腸炎啦，或者係膀胱炎，患者喺飲食上邊有啲咩需要注意㗎？
飲食方面呢，主要是不要吃一些煎炸、燥熱的、油煎火烤的這些食物，要多吃一些清潤的。清潤的食物主要是什麼呢？主要是一些蔬菜啦、水果啦，這些深綠色的蔬菜。但是你在主要是用另外炮制这个食物的时候呢，尽量是蒸或煮，不要煎炸，它就变得了没有那么燥热了。这就是清润的，主要是蔬果类的。
咁劉教授有冇啲藥膳可以推介俾大家㗎？
有一款比較簡單的食療呢，主要是白茅根30克。槐花10克，赤小豆15克，果根15克，这个煎水當茶喝來舒緩這些症狀就可以了。
咁有部分前列腺癌術後或者係放療後嘅患者，如果佢哋出現咗尿失禁嘅問題，中醫有冇啲調養方法㗎？
有些特別像前列腺癌，他已經做了這個前列腺癌的刮除術，再加上放射治療呢，就容易出現一個尿失禁，又叫遺尿，它這個情況有的還是比較嚴重。那麼我們中醫角度呢，可以做一些鍛鍊的。鍛鍊的有一個動作呢，叫做抬根墊腳，抬起腳跟，墊起腳尖，然後收縮肛門，提氣，這樣一個動作呢，就可以是提升中氣，減少遺尿的機會。那麼要做多少次呢？每一次呢要做10次，早午晚各做1次。這樣是每天堅持。
咁有冇啲咩穴位按摩係可以舒緩呢一個症狀㗎？
主要介紹2個穴位，一個是百會穴，一個是腎腧穴。百會在頭頂，它具有益氣、溫陽、身體中氣的作用。那麼第二個是腎腧穴，它是在第二腰椎的旁邊1.5寸的位置，那麼具有補腎、縮尿這個功能。
咁劉教授有冇啲食療可以推介俾大家嘅呢？
有一款比较简单的食疗方呢，主要是用枸杞子20克，那个莲子20克，加上这个前石20克，黑桃仁5个，煲汤饮用呢，可以帮助补肾，固涩，这个减少尿失禁的这个机会。
大家面對任何嘅疾病，記得一定要調整好自己嘅心態，有信心先可以打勝仗。今日再次多謝劉宇龍教授提供專業嘅寶貴意見，我哋下集再見。
Okay, so those were the 2 episodes looking at treating overall cancer kind of treatment strategies through Chinese medicine, and 1 episode addressing side effects of radiotherapy or radiation for various cancer pathologies with some of the TCM therapies suggested there. So now we're going to look in our textbook at the lung cancer itself. So lung cancer or bronchial carcinoma is a common pathology, more common in countries where smoking is prevalent. Here in North America, it's slowly, rates are dropping down because cigarettes are very expensive for people to buy. Unfortunately, in a number of other countries in the world, cigarettes are more affordable and people are having increased rates of cancer, especially with younger people where smoking is considered like something socially desirable. So clinical manifestation often presents like a form of growth on a cancer, weight loss, breathing problems, coughing blood, basically chest pain, often pain then radiates from front to the back into scapular area, low appetite, low energy because of lack of breathing, problems with sleeping, headaches, neck pain, and others. So etiologically, there are several major themes: pathogenic toxin invading lungs, which often means the lung qi descending is blocked and lymphatic system nodes, namely in armpits, axillary area, clavicular area, are not functioning, they're blocked. Exuberant phlegm damp, when we have a lung and spleen qi deficiency in the background, most likely constitutional or lifestyle driven. And then patients are often smokers, they drink alcohol, they maybe eat spicy food, they don't drink enough water, but maybe constitutionally they have a presence of pulmonary carcinoma. So then this leads to thickening of fluids into dampness, then phlegm, so phlegm damp, and heat toxins. Deficiency and depletion of ZAMP for organs may be constitutional, lifestyle driven, also a combination of both. Occupational, like working in industries where you inhale small particles, asbestos, mining, manufacturing industries, where eventually we have deficiency of qi and yin in the lung, but also at spleen, kidneys, and toxicity of the liver, leading eventually to malignancy growth in the pleural space. So we'll look at main patterns that we would see. Again, we would not probably see these patients coming to us as a primary caregivers. Instead, they would probably go to family doctors, specialists, and get treated. And we would often see them here in Ontario as a secondary practitioners dealing with side effects of post-surgical state, radiation or chemotherapy, or side effects of the endocrine or hormonal targeted therapy. So first pattern is the heat toxins and lung yin deficiency. So we have dry cough with the phlegm, we have scanty sticking phlegm, blood streak phlegm, productive cough is hard to expectorate and cough it out. Person is irritable, has problems with sleep, hot flashes, sweating, especially at night. Often their cheeks look red, dryness in the mouth, overall dehydration such as constipation, dry hair, dry skin. We look at the tongue, it's red and dry, sometimes a bit swollen, Sublingual veins may be dark red. Pulse is generally surging, tready, or rapid. Treatment principle is to enrich the lung yin, moisten the lungs, clear the heat in upper jiao and lungs, and relieve toxicity and trigger lymphatic drainage. So the formula we will use is Qingzhao, Jiu Fei Tang Jie Jian, decoction for clearing dryness and rescuing lungs. So again, in this formula, we're trying to rehydrate the lungs, detox the pleural space, activate lymphatics, and thin down the phlegm in the masses. Qi deficiency of spleen and lung often leads to dropping zheng qi and overall lack of motility and movement of the qi and the fluids. So we have enduring cough with loose phlegm, oppression in the chest, shortness of breath, problems with breathing, swollen, puffy face, reduced appetite, and low energy, abdominal distension, lack of energy on a muscular level. Tongue is often swollen with teeth marks, maybe greasy or white coating. Pulse is moderate, tready, and sometimes forceless or weak. Treatment principle is to boost both lung, spleen, and qi level, thin down the phlegm, dissipate the tumor. So we use 6 gentlemen decoction combined with platicodon decoction. So that's Liu Junzhen 6 gentlemen decoction, He combined with Jig and Tang Jie Jian. So platicodon decoction with modification. Again, we're boosting lung and spleen qi, boosting zheng qi. We're thinning phlegm, we're thinning the masses. Accumulation of phlegm damp in the lungs means that there is, again, in the background, lung and spleen qi deficiency, patient leading to dampness and phlegm that blocks the lung, creates malignancies that are growing. So patient presents with severe cough or profuse white or yellow phlegm. There's that rallying in the throat when they're talking, chest oppression, heaviness in the chest, neck, and the head, facial swelling and edema, limbs edema because the lung qi is blocked from moving downward, fatigue, lack of strength, low appetite, diarrhea. When we look at tongue, it's swollen, it's pale, white or greasy coating present, pulse is slippery and rapid. Treatment principle is fortifying spleen, but also lung and qi level. Thin or transform the phlegm into dampness, get rid of the dampness, dissipate tumors, and relieve toxicity by activating the lymphatic system. So calming stomach powder with modification, Pingwei Sanjie Jian, is used here to work on this syndrome pathology. Liver qi stagnation and liver blood stasis is another syndrome that we're looking at. So we have inhibited coughing, phlegm streaked with bright red or dark red blood, rapid breathing, sharp fixed pain, person is irritable, combative almost, thirst, dry stool, constipation. Tongue is usually purplish, bluish purplish with purplish sublingual vein, thin yellow coating. Pulse generally is wiry, tready, rough, or irregular. Treatment principle is to regulate liver qi and invigorate liver blood, transform stasis of blood and stagnation of qi, and relieve toxicity. So Shui Fu Zhi Tang Jie Jian, the decoction for expelling stasis from house of blood with modification is applied here. Lung and kidney deficiencies. So often here we have initially lung and kidney qi deficiency, may move depending on the severity and length of disease to lung and kidney yin deficiency. So it really depends how long patient has these pathologies. Often when we see them, they may already have them for years. They may go to a round or two of biomedical treatments. So assume years of pathology. So we have elements of qi, probably yin deficiency of both lung and kidney. So lack of strength with coughing, phlegm, so productive cough, shortness of breath, dull white facial complexion, poor appetite, abdominal distension, aching lower backs and knees, fatigue, night sweating, spontaneous sweating daytime, generally poor microcirculation in the limbs, cold limbs, aversion to cold. So this sometimes can also lead from qi to lung and kidney yang deficiency, and eventually to lung and kidney yin deficiency. Tongue body is red or pale with thin white coating, pulses deep, thready, and forceless, so at the qi and yang level. So treatment principle is supplementing lung, enriching kidney, augmenting the qi of both organs, relieve toxicity, activating lymphatic system, and thinning down the masses. So we have a combination of the, two formulas, Sha Shen Mai Dong Tang, combined with Li Wei Di Huang Tang Jie Jian. So adenofora, guanina, and opigon decoction combined with 6 Romania 6 ingredient decoction with some modifications. So we have basically qi, yin, and blood and yang tonification, activation of the lymphatic system, and reducing toxicity and thinning down the masses. Lung yin deficiency in late stage cancer, so we're talking about stage 4 cancer, is basically the late stage. Often we see, unfortunately, lots of patients here who at that stage are desperate because biomedicine worked partially or not as much, and so they're like now fishing for additional care. So we came as a second or third kind of opinion, clinically speaking. So at that time, patients are very deconditioned, they're very dehydrated. We're talking about palliative level care. So curative level at this point is often not possible. Surgery bought them time, radiation and chemo bought them time, but overall, he also damaged their tissue, their qi and blood, yin and yang. So at this level, you know, we have lots of basically side effects. So from radiation, from chemo, from surgery, from targeted hormonal therapy. So we have cough, which we may treat herbally again, cough that is productive, sputum, coughing, blood, wheezing, and other respiratory disorders such as shortness of breath, chest oppression and a pain, alternating or surging fevers, right? And where they're in and out of emergency, or low-grade chronic fevers with sometimes episodic acute presentation. Spontaneous sweating, hot flashes, shortness of breath, pleural effusion, so water buildup in a pleural cavity, scrofula, right? And metastatic tumor of bone and bone pain as it spreads around. So again, depending on what presentation is, we may fall back to chapters 4 and 5 and use different either patent formulas or made formulas if we're trained in that oncological kind of herbal pharmacology. Acupuncture can work as well. So we typically use the combination of back shu points, distal systemic points. Lots of them are from metal family, lung, large intestine. For example, bladder 12, bladder 13 for lungs, bladder 15 for heart, bladder 42, Gao Huang for diaphragm, lung 1, CV 17, CV 22 as well, lung 5, right? Lung 7, PC 6, stomach 36, large intestine 4 and 11. So these points are generally used to regulate locally. So back shu points, frontal points, front points over the lungs, and then distal points. They're also systemic. Moxa can be used at certain level for qi and yang deficiency, especially yang deficiency. So points on governing or Du vessels may be used. So Du 20, Du 22, Du 23, bladder 7, local points like Tai Yang Yin Tang, stomach 2, gallbladder 14, right? So all these techniques can be used through moxa. Most of the time we use indirect moxa, so moxa pole. Sometimes these patients are bothered by hot, acrid smoke. We may use the TDP lamp or electromoxa devices like Premio 10. Auricular ear acupuncture can also work by extending effects, adding to the depth of the clinical effectiveness by leaving tack needles or seeds in the ear. So lung points like upper and lower lung, heart, large intestine, adrenal glands, endocrine, nose, throat, and chest, plus master points like point zero and Shenman are used in between. And so these are typically patient wears them for about 5 to 7 days, removes them day before they come to see us, and that way they enhance the overall treatment. Generally, we see patients here post-surgically, post-radiation, post-chemo, again, as adjunct therapy, as a complementary therapy. In surgery and post-operative period, we may basically focus on, again, side effects. So often that could be swelling, redness, pain, slow healing rate, and so on. So again, here the authors are exposing us to proprietary formulas from the hospital oncological department. For example, liver, spleen, and stomach disharmony, they use this proprietary formula to fortify spleen, harmonize stomach, dredge the liver, regulate the qi. So in patent formula, we may go with something like Xiaoyao San or Chai Hu Shu Gan Wan. With qi and yin deficiency, often the lung problem or lung level of lung qi and yin deficiency, we may treat lung, but also mother organ, spleen. So something like Liu Wei Di Huang Wan or Liu Jin Zentang 6-channel decoction, or Rehmannia 6 may be used as well. So acupuncture can be also used successfully in post-surgical stage with addressing certain side effects, like, for example, ongoing coughing due to weakness of lung qi. And so we may supplement lungs, fortify spleen, so backshoe points like bladder 13, but also bladder 20 for spleen, lung 7, stomach 40, spleen 3, and lung 9 may be used with the needling and moxa to some degree. Chest pain due to lung qi deficiency, basically weakness of lymphatic system, weakness of descending lung qi may cause the phlegm binding the chest and cause the heaviness and chest oppression. So points like CV17, CV22, TN2, lung 9, PC6, bladder 20, bladder 13, stomach 40, spleen 9 may be used as well to address that chest binding pain. Wheezing due to lung qi deficiency. So again, CV17 and 22, bladder 43, lung 5, lung 7, lung 2, Ding Chuan, so the asthma wheezing point at the back. Dad's Way, do 14, or governing rest of 14 may be used as well. Hemoptysis, coughing up the blood, often due to lung yin deficiency or deficiency fire, or heat toxins combined with lung and kidney insufficiency in the background, may constantly produce the hemoptysis or coughing up blood. So lung 5, lung 6, kidney 7, kidney 3 may be used as well. Sometimes we may add also lung 10, Eugene, because of heat in the lungs itself. Loss, aphonia, or hoarseness of the voice, or partial loss of voice may be also part of the post-surgical presentation due to lung qi, lung yin, kidney insufficiency. So points like large intestine 17 and 18, lung 11, kidney 3, large intestine 4, REN or CV 17 and 22 may be used as well. Ear acupuncture can again be used for side effects. So post-surgically, so lung, spleen, Shenman, 0.0 for coughing, chest pain, heart, chest, liver, and Shenman, 0.0 I may add. Wheezing due to lung deficiency, lung, bronchi, large intestine, liver, sympathetic nerve, and I would add 2 master points of 0.0. and Shenman. Coughing up blood, lung adrenal gland, Shenman subcortex, and 0.0. So other therapy that we often see is radiotherapy, with, again, between 8, 10, and 12 sessions, often with external radiation beam or internal radiation source put usually next to surgical site to prevent replication of malignant cells. Of course, we often see toxicity being built up with this therapy. We see the fluid dehydration, so yin deficiency, dermatitis, or basically a dryness and burns on the skin due to a local application of radiotherapy. So treatment on nourishing yin, clearing lung heat may be used in terms of herbs. Topical applications of Qingwang Huang burn ointment or general ointment may be used to help with healing of the dermatitis and burns. And of course, chemotherapy is used with a number of side effects. And these side effects are often vomiting, nausea, poor appetite, bone marrow suppression, mouth ulcers, toxicity in kidney, liver, spleen, and the lungs. So one of the syndromes we're looking here is qi and blood deficiency with pronounced heat and toxicity. So treatment principle is to cool and supplement qi and blood. So we would use, again, one of the hospital-based formulas or patent formula that deals with nourishing lung yin and lung blood and qi. And so that could be either something like Bajing Tang or Shikuang Dabu Tang. Next one is qi and blood deficiency with pronounced cold signs. So basically anemic-like presentations, lung qi deficiency, maybe pulling toward lung yang deficiency with the lung blood deficiency in the background. So again, authors are here exposing us to hospital proprietary formula, which we may replace with some of the patent formulas. So again, one of the major tonics like qi and blood levels, so Guipi Tang or Bajing Tang. These medications will probably not be given in a tongue or a soup decoction because often patients will vomit them because of taste, smell. So we may probably prescribe the tablets instead because they easily swallow, and may even need the patient to crush them and drink them with a thick juice so they don't get to taste, right? Or just try to swallow them as best as they can. Dietary therapy, of course, can help tremendously because, between the treatments, patient has to nourish themselves. So often soups, risottos, or congis, easily digested to cooking will be suggested with certain herbs added to it. Qigong therapy that we saw for breast may be applied also to lung cancer as well. It's important to stress this to patient that they need to be physically active to maintain lymphatic drainage. So almost all of the exercises we saw with breast cancer, Qigong therapy can be used easily with lung one as well. So we're going to shift a bit and we're going to look at the surgical treatment and as an intervention, because that's usually in the West what patients encounter first. So I think it's important for us to get comfortable and knowledgeable about what patients underwent to understand the level of side effects after they come to us. So let's have a look at that presentation.
That are early stage, we can take out less.
Hello, I am Tai Zahir, National Director of Lung Cancer Education at the American Lung Association, and today I will be moderating our session. Welcome everyone to today's Lung Cancer Patient Meetup on the Go, lung cancer surgical intervention options. I would like to acknowledge our sponsor, Northwell Health, for supporting lung cancer education programs like our session today. The session will feature Dr. Darren Rohan from Northwell Health. He will discuss surgery methods and approaches. In addition, we will cover what you will need to know before you or a loved one gets their surgery. Dr. Rohan is the Westchester Regional Director of Thoracic Surgery program for Northwell Health, treating patients at Lenox Hospital, Northern Westchester Hospital, and Phelps Hospital. He is a highly skilled leader in robotic thoracic surgery with expertise in robotic and minimally invasive thoracic procedures for lung surgery, hernias, gastroesophageal reflux disease, esophageal cancer, and mediastinal masses. At the forefront of innovation in robotic technology, Dr. Rohan has pioneered and has many groundbreaking accomplishments. He was the first thoracic surgeon in the country to use Da Vinci Xi robot for surgery, a robotic surgical system that allows for smaller incisions, enhanced flexibility, and pinpoint precision. He is also the first in the nation to perform a lung lobectomy with the Da Vinci Xi robotic system. Dr. Rohan identifies patients with lung cancer who might be a benefit to clinical trials. He is also working to develop new techniques and treatments for reflux disease. Dr. Rohan serves as assistant professor of cardiovascular and thoracic surgery at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. He is a member of various prestigious medical societies, including the Society of Thoracic Surgery, the New York Medical Society, and the American College of Surgeons. As we begin, please note that participants will be on mute. Participants may ask questions in the Ask Questions feature of the webinar platform. We will have a brief question and answer session at the end after Dr. Rohan's presentation. At this time, it is our honor and privilege to have Dr. Rohan speak. Dr. Rohan, the floor is yours.
Thanks, Ty. Thanks for the introduction. Welcome. Good afternoon. I want to talk today about lung cancer surgery, and I'm going to focus mostly on treatment of early stage lung cancer and the advancements. We're going to describe the staging for lung cancer and the treatment guidelines, including the role of surgery in early stage lung cancer. We'll also talk about the tools we have for diagnosis and staging, and then talk about minimally invasive techniques that have been used over the past 10 to 15 years to really make lung cancer surgery more of a straightforward procedure and better tolerated for patients who unfortunately develop lung cancer. When we talk about lung cancer, unfortunately, it's the leading cause of cancer death for both men and women. In 2008, there were about 215,000 new cases of lung cancer, and approximately 161,000 people will die of lung cancer each year. So the expenses that we cost to treat lung cancer is exorbitant. In men, lung cancer is much more common to cause death than prostate cancer and colorectal cancer. And even in women, lung cancer deaths are more common than breast cancer and colorectal cancer. As a society, we've been screening for colorectal cancer and breast cancer for many years. Lung cancer screening is something that, as physicians, we've been pushing for and have begun to see that in the past 5 years. We now screen high-risk patients, those patients with a history of smoking in the past 15 years, between ages 55 and 77, that don't have any symptoms. they can get a low-dose CT scan to see if they have any evidence of lung cancer. We've done trials to show that by screening the right population, we can find lung cancers earlier. And the earlier we find lung cancers, the better we can treat them. If we find early stage lung cancers that are stage 1 or early stage 2, we can decrease the mortality of lung cancer just by screening. So, you know, the population, there's approximately between 8 and 9 million patients who are considered high risk, and we can save approximately 12,000 lives a year just by doing lung cancer screening. So this society, you know, the Society of Thoracic Surgeons has really pushed to screen for lung cancer, given the amount that we see. You know, the benefits of screening is finding lung cancer early. There are some risks because when we do CAT scans for patients, there is a risk that we'll find other things or nodules that aren't cancer and give patients you know, a risk of undergoing procedures that they wouldn't otherwise need. But now that we've been doing this for several years, we found that when we screen the correct patients, the benefits certainly outweigh the risk. Moving forward, I just wanted to show you what lung cancer can look like. So these are 2 CAT scans, and on the left, you can see this mass, which is probably about the size of a golf ball. This is a lung cancer. Now, despite the size of it and the location, most likely this patient would not have any symptoms, meaning this mass could grow for, you know, months or years before anybody would realize that there is a lung cancer. If you look over here, this finding is much more subtle, and this is usually how lung cancers start. Normal lung is this gray color on a CAT scan, and you can see the abnormality here, which is also a lung cancer. When we talk about lung cancer, it's important to understand the anatomy of the chest. So there's 2 lungs, the left lung and the right lung. The heart is in the middle, and it's between the left and the right lung, more leaning towards the left-hand side. On the left side, the lung is broken up into 2 lobes, the upper and the lower lobe. On the right-hand side, we have the upper lobe, the lower lobe, and also the middle lobe. Each of these lobes of the lung has its own blood supply and blood drainage. Also, the windpipe or the trachea goes down and breaks off into the left and right bronchus, and that's how air gets into the lung. So when we find lung cancers, more often than not, these cancers are in a specific lobe of the lung. Sometimes when they're larger, they can be in 2 of them, and when they're more central, they can affect more than 1. But depending on the lobe the cancer is in, that kind of directs the surgery that we do. So again, this is just to better show the lobes of the lung on the left and the 3 lobes on the right. Now, going further down, when we look at the lungs, each lobe has segments that have their own blood supply. So the upper lobe of the right lung has several segments, and each lobe has different segments. And as we find lung cancers that are smaller, we can identify the segments that they're in. And sometimes, depending on the size of the lung cancer, instead of taking a lobe or a larger portion of lung, we can remove certain segments. And so overall, there's 10 segments on both the left and the right, divided between the lobes of the lung. The imaging that we do to see lung cancers, classically in the past, we've used a chest x-ray, and you can see a chest x-ray here. Now, when cancers and abnormalities are large in the chest, we can see that on the chest x-ray, and it's very clear. The problem is sometimes when these cancers are small or subsolid, a chest x-ray can miss it. And so in the past, we've done chest x-rays, and I'm sure patients have gone to doctors and doctors have ordered chest x-rays, and patients can feel a false sense of security if the chest x-ray is negative. Certainly there's no large cancers, but there still can be small cancers that are hiding. And so we've moved more towards the CAT scan of the chest, which this is a picture of. And with the CAT scan, you really get a good sense of what's going on within the lung. And if there are small abnormalities like this one here, we can find lung cancers early. So when we screen patients, we screen them with CAT scans and not chest x-rays. And a CAT scan will show a lung cancer if a lung cancer is there. So now, what do patients feel if they have lung cancer? And this is the problem. The first thing up here, asymptomatic. Most patients that have cancer of the lung that's early feel nothing. They don't have any weight loss, no cough, no shortness of breath. And so what happens is lung cancers can continue to grow and spread without anybody knowing it. When lung cancers get bigger and involve more central areas, patients can develop a cough, they can develop shortness of breath. Sometimes they can cough up blood. Sometimes they'll complain of chest pain or an infection. And then when the cancers really begin to spread, patients can have weight loss. So when we do CAT scans, what we can see are lung nodules, and those lung nodules can be lung cancer, but they can also be other things. Abnormalities in the lung can be due to infections, they can be due to bacteria, they can be due to fungal infections, they can be due to mycobacteria, which is the cause of tuberculosis. We also find inflammatory nodules. Sarcoidosis can cause nodules. Rheumatoid arthritis can cause nodules in the lung. You can find benign nodules like hamartomas or fibroid nodules that may be growths, but they're not malignant cancers. And then lung cancer, the classic lung cancer, is divided into two types, the small cell lung cancer and the non-small cell lung cancer. In general, small cell lung cancer is a more aggressive type of cancer, and it's rarely found early, and it's rarely treated with surgery. Most commonly, we treat non-small cell lung cancer with surgery when it's caught early enough. So how do we diagnose lung cancer? Like I discussed, really the best way to diagnose lung cancer is to see an abnormality on a CAT scan. Once we see an abnormality on a CAT scan, we do other tests to confirm whether or not that is lung cancer. And the tests that we do, the next test that's normally done is what's called a PET scan. A PET scan is very similar to a CAT scan, except that it looks for increased activity within a lesion. So a patient is given a sugar solution in their veins, and it's looking for cells that pick up the sugar solution faster than other cells. And those cells would light up on a PET scan. And cancer can cause PET scans to light up. We can also have inflammatory problems that cause PET scans to light up. We can also see if lymph nodes are involved or if there's any evidence of spread. Once we know that we have something that's concerning, it's important that we do a tissue diagnosis to confirm that it is lung cancer, and then to see what type of lung cancer it is. And so there's several ways to do diagnosis with tissue: a bronchoscopy, where we put a camera down the windpipe, and we can do biopsies that way. The second option is a needle biopsy, which is done with a CAT scan assistance, and a needle is placed on the outside, through the outside of the chest between the ribs to the nodule. We also have new technologies called navigation bronchoscopy, which gives us a GPS of the lungs and allows us to drive a bronchoscope virtually, using virtual guidance into the lung and to get a diagnosis. So this is a picture of what we see when we get far enough out where we can't look. We can use the GPS bronchoscope to get to an area of concern and do a biopsy. This is called electromagnetic navigation bronchoscopy. It uses bronchoscopy and CAT scans, as well as electromagnetic device to guide us where we need to go. So a patient would sit on electromagnetic field, and then the physician would do a normal bronchoscope, but would have all the extra information to guide the camera and guide the guide to a nodule or to a mass in order to make a diagnosis. So here you can see we're far out in the lung where we have an abnormality that we think is a lung cancer. Once we've driven there, we can use either a needle or a forceps to take a piece of the tissue, and we usually have a pathologist right next to us who takes that tissue and can tell us whether that's a cancer or not. We could use needles, we could use brushes, and we can use biopsy forceps, and this is all the way deep within the lung. So back to the anatomy, when we are talking about lung cancer, we need to know where in the lung it is. We also have to look at the lymph nodes associated with the lung to help us accurately stage the lung cancer. So lung cancer staging is based on where the lung cancer is, how big it is, if there are any lymph nodes involved, and where those lymph nodes are. So there's lymph nodes within the lung, which are called hilar lymph nodes. They're either on the left hand or the right hand side. And then there's lymph nodes in the middle of the chest, which are called mediastinal lymph nodes, and they go on either side of the trachea, under the trachea where it bifurcates to the left and the right, and even lower down. So that's how we stage a lung cancer. So there's specific stations that we use, and they're given numbers. So depending on where the lymph node is within the body, we'll give it a number. So an upper tracheal lymph node in the middle of the chest is numbered 2. A lower is numbered 4. Depending on the side, whether it's left or right, we'll give it an L or an R. And then once we get deeper into the lung tissue, those lymph nodes in the hilum are numbered 10, 11, and 12, and then left or right. There's lymph nodes that are between the aorta and the pulmonary artery within the chest. Those are labeled 5 and 6. So knowing the lymph node status and knowing the size of the cancer, we can start to figure out the stage. Now, staging is important because it determines the treatment of the lung cancer. Early stage lung cancers are treated with surgery. Later stage lung cancers are treated with other treatments and then possibly surgery. So the first thing we look at is the size, and that is the T stage. A T1 is less than 3 centimeters. A T2 is between 3 and 5 centimeters. T3 is between 5 and 7 centimeters, and T4 is 7 centimeters. The next thing we look at is whether any lymph nodes are involved. N0 is no evidence of lymph node involvement. N1 is when the lymph nodes within the hilum, within the lung itself, are involved. And those middle lymph nodes around the trachea, if they're involved, they're classified as N2 lymph nodes. And N3 lymph nodes are lymph nodes that are on the other side. Finally, we look to see if there's any evidence that the cancer has spread, and that's whether there's metastasis. M0 is no metastasis. M1 is evidence of metastasis. And once we know the T, N, and M, we can stage lung cancers. And the stage of the lung cancer is important because that's going to determine the optimal treatment. So a stage 1A, which is treated with surgery, is a 3 centimeter or smaller lung cancer that has no lymph nodes involved. And as the stages go higher, the cancers are larger, they're more close to the middle of the chest. And once we get to stage 2B and 3A, those are when lymph nodes are involved. Stage 3B is more advanced, and stage 4 is when it has moved to other areas besides the lung. For example, it can move to the brain, it can move to the liver, it can move to the bone, or it can move to fluid around the lung, and all those are stage 4 lung cancers. So early stage lung cancer, stage 1, the lymph nodes are negative, the tumors are small. Stage 2 would be a larger tumor, and you might have lymph nodes that are within the lung on that side, the hilar lymph nodes. Stage 3 has more diffuse lymph node involvement and a bigger tumor, and stage 4 has metastasis. So when we look to make sure how we stage patients correctly, we use CAT scans, we use the PET scan, and then we also use tissue to make sure we know exactly what lymph nodes are involved to accurately stage patients. So 2 ways to do that is with a mediastinoscopy, where we can actually put a camera outside the windpipe, and that way we go in and biopsy the lymph nodes to decide for sure whether these lymph nodes have cancer. And it's important to do that before we do any surgery, because if there's cancer involved, the studies show that getting chemotherapy or chemo and radiation therapy before surgery leads to a better survival. So we really do our best to make sure we know the stage accurately before we do the treatment. We can also use an ultrasound on the end of a bronchoscope to biopsy the lymph nodes. These ultrasounds can allow us to put a needle in the lymph node and get some tissue in order to see whether the lymph nodes are involved. And the ultrasound can allow us to biopsy deeper lymph nodes to truly get an accurate stage of what the patient has. You can see on this ultrasound, if you look closely, the needle is going into a lymph node, which is right here, and that way we know for sure whether that lymph node's involved with cancer or not. Sometimes we try to get a diagnosis, but for whatever reason we don't get cells. we do the best we can with the information that we have. So now let's kind of turn to really the crux of what I want to talk about, and that's surgery for lung cancer. And so when we talk about surgery for lung cancer, there's several things that we take into consideration. Obviously, what I was talking about before, we take into consideration the stage. But we also need to look at how do we access the lung? Do we make a large incision? Do we make smaller incisions? And then we have to understand, once we get there, how much lung tissue do we take? And so those are really the main components of lung cancer surgery. But in general, the aim of surgery for lung cancer is to completely remove the tumor and all the associated lymphatic drainage. We want to go try to remove lung tissue without really touching the tumor at all. So we try not to cut into it or disturb it in any way. We want to remove whatever we have to in order to get the whole cancer out. In addition, we have to do it safely, limit postoperative complications, and then we need to make sure patients are strong enough that if they need treatment after surgery, they'll be strong enough to have it. So what are the indications for surgery for lung cancer? So in patients that have stage 1 lung cancer, where they have a 3 centimeter or less cancer and lymph nodes are negative, then the surgery is indicated to remove the cancer. And as long as it's less than 4 centimeters, it's surgery alone. No further treatment is necessary. For stage 2, we still recommend surgery as being the optimal treatment to treat stage 2 lung cancer, but then patients will be referred for treatment with chemotherapy after. When we're dealing with stage 3A cancers, we try to treat patients with either chemotherapy or chemotherapy and radiation first to try and shrink the cancer and treat the cancer before we remove it. And then any stage higher than that is usually not treated with surgery. The goal for surgery is to cure the patient, to get every amount of cancer that we can see out. And if we do that, we do have a chance of cure. So like I said, the extent of surgery, how much lung do we remove, is important. There are several amounts of tissue that we can remove. The smallest amount is called a wedge resection, where we just remove a piece of lung not associated with the anatomy that might contain the cancer. The next amount of tissue that we remove is the segmentectomy, where it's a portion of the lobe of the lung. So like I said in the beginning of the presentation, on the left-hand side, there's 2 lobes, an upper and a lower lobe. Each of those lobes has approximately 4 to 5 segments. So we can remove each individual segment or a combination of segments and leave more lung tissue. Lobectomy is classically what we used to do to treat lung cancer. So in the past, before we screened patients, if we found a lung cancer, we would remove the lobe. So that might mean removing a half or a third of the lung, depending on what side. And finally, pneumonectomy is removing the whole lung. And for central tumors or big tumors, sometimes removing the whole lung is really the only way to get all the cancer out. The second thing we look at is, how do we approach the surgery? How do we get there? So in the past, an open thoracotomy, which is where we make an incision on the patient's side, go between the ribs. We would spread the ribs, cut the muscle, and it would give us access to the chest. Now, in the past 15 years, we've been able to do more minimally invasive approaches. And we started with what's called a video-assisted thoracoscopy, where we had cameras and instruments. And that very quickly led to robotic-assisted surgery, which now is the most, certainly one of the most common ways of lung cancer surgery over the past 10 years since I've been doing it. I think when I started, maybe 7% of all lung cancer surgeries were done with the robot. And I think now we're up to 60 to 70%. So in the past 10 years, it's becoming the most common way that lung cancer surgery is being conducted. And with removing a portion of the lung, we also have to remove the lymph nodes in the chest. And those are really the important aspects of surgery. So when we talk about the extent of surgery, lobectomy is the gold standard. So each lobe of the lung has its own blood supply. It's got its own artery, its own vein, and its own windpipe. And so when we remove that portion of the lung, we will specifically dissect each vessel to the lobe separately. And once we do that, we'll tie it off or cut it off and then divide it. And then we can remove that lobe as well as the lymph nodes around the lobe. So in this schematic, this is one of the arteries going to the lobe. There would be lymph nodes associated with this artery, and we would take those lymph nodes out as well and send them to the pathologist. Now, as we have found earlier lung cancers and smaller lung cancers, we are able to take less tissue, but still do an adequate job of getting all the cancer out. In addition, as we're operating on older patients, some of them don't tolerate having half their lung out, so we would take less in those patients. And then we still find large tumors that are in the middle of the lung that would require either removing 2 lobes or the whole lung. So what we found, and this was a study done by Dr. Ginsberg, it's now almost 30 years ago, he found that when you took less than a lobe, the survival wasn't as good. And so because of this study, we would take a lobe for any lung cancer. Now, the patients that they were seeing back then are different than what we're seeing now. The size of the tumors were much larger, and so taking a lobe was absolutely necessary in order to make sure you got all the cancer out. But now with lung cancer screening, I routinely see cancers that are 1 centimeter in size. I can get a good margin and all the lymph nodes I need to get out with and leave tissue in. And so the amount of lung tissue that we take out is changing as we move forward. So this is a more recent study, and this is just looking at stage 1 lung cancers. It's looking at lung cancers that are approximately 2 centimeters in size. And they said, well, do patients do better if you take out the lobectomy like we knew they did in the past, or can we take out less tissue? And what we're finding more and more is that for patients that have small cancers that are peripheral, that are early stage, we can take out less lung tissue and leave them with more lung tissue. And what that does is it allows for the breathing to be better. It allows for patients to recover quicker. And then, unfortunately, it allows that if those patients develop another lung cancer, we can treat that with surgery. Going back to the lobectomy, it is still the standard of care for lung cancer. So most patients that are diagnosed with it, most surgeons will do a lobectomy. And you can see that what we need to do is take the artery, the vein, as well as the bronchus to that specific lobe, the lymph nodes as well. But I will tell you, and in my practice, for certain patients that have cancers that are less than 2 centimeters, we're doing what's called a sublobar resection, where we just do a segmentectomy or multiple segmentectomies, and we try to leave as much lung tissue as possible. So how do we approach surgery? The approach, how do we get there? The lung is deep to the ribs and the muscles of the chest wall. Up until about 15 years ago, the only way to get there was to make large incisions, to spread the ribs, and to cut the muscles. And that gave us excellent access to the chest, but it was a very difficult surgery for people to recover from. They had lots of pain, lots of risk of complications, pneumonia, things like that. And so a posterolateral thoracotomy is the classic chest incision that we used to make, where patients are put on their side and the incision goes below the scapula, and the ribs are open and spread. And if anybody had lung cancer surgery 15 or 20 years ago, that's usually the incision that was made. We've begun, we try to make smaller incisions, so we would do anterior thoracotomy or a limited thoracotomy. But about 15 years ago, we were able to start doing minimally invasive approaches, and that's the video-assisted and robotic surgery. So this is a patient, and you can see the line of where the incision would be. It's open surgery. We have to cut the muscles, spread the ribs. It's difficult to recover, and it's what we used about 15 years ago. Now, many surgeons do what's called a VATS approach, where it's VATS stands for video-assisted thoracic surgery. We make small incisions, and we can put instruments in. We have a camera with a high-definition visualization, so that we can do the surgery but not spread the ribs or cut the muscles. The surgery is the same, whether we make a large incision or whether we use the small incision. We do the anatomic lobectomy with dissecting the lymph nodes. And when we don't cut the ribs or cut the muscles, usually once the specimen is dissected out, we'll put it in a bag, make the incision a little bit bigger, and pull it out so that we don't contaminate any of the chest wall. And so the idea of this surgery is it's done exactly the same way as we used to do it. However, we do it through smaller incisions. And so to do that, there's special instruments. These are longer instruments, similar to instruments that we used for open surgery, but they're developed specifically to do through small incisions. One of the keys that for lung surgery is what's called a surgical stapler. This device was originally made in Russia back in the 50s and the 60s. And what it does, and it's been improved over the years, but it goes across tissue and it staples on both sides, and then it's got something that cuts the tissue in between. So we can use this on the lung tissue. We can use this on the arteries and the veins. There's special staplers for each of them. And it's how we are able to cut lung tissue without having it leak air or leak blood or anything like that. And it's really key in lung cancer surgery. So the advantages of not doing an open thoracotomy, there's less pain, patients recover quicker, there's less inflammation, we leave a chest tube in shorter. A chest tube is a tube that we leave in for any lung surgery, and what it does is it drains any air, fluid, or blood so that that doesn't build up within the chest. And so that tube usually stays in for several days, and then we pull it out in the hospital before we send the patient home. There's a shorter length of stay, early return to full activity, and then if patients do require chemotherapy, they are able to get that more effectively if their surgery is tolerated better. So the survival depends on the stage. A stage 1A lung cancer, the 5-year survival is right now between 90% and 100%. But as the cancer stage goes up, the survival unfortunately goes down. And this is clear to us, and it's why we do everything we can to diagnose and find lung cancers earlier rather than later. And screening has certainly helped with that. Now, my focus is robotic-assisted lobectomy, and it's done with the Da Vinci robot, the same robot that does now general surgeries, prostate surgery, hysterectomies. And so we use the same robot, but we use it in different areas. The advantages are, you know, I can do the surgery and control the instruments and the camera much better. The instruments bend. They act as miniature hands, miniature wrists. So I describe patients that if we don't use the robot, it's like using instruments on the end of chopsticks versus the robot gives us much more ability to dissect out the lung, to find the lymph nodes, and remove the portion of the lung safely with, you know, as minimal bleeding, as minimal discomfort as possible. So the surgery, there is a robot machine at the bedside with 4 arms. My assistant is at the bedside. They change the arms as needed. I will be sitting at the console looking and controlling the arms with the hands in the console.
Okay, so we're gonna stop here. So this gave us a bit of a sort of play on what's out there, what the patients are undergoing when they're having lung surgery, and basically what do we encounter after they have this kind of lung surgery, and what do we deal in terms of side effects like swelling, inflammation, pain, decreased circulation, and cough, and other psychological issues, where we act as an adjunct form of therapy. So today we covered the breast and the lung therapy, or sorry, lung cancers. Next week, we're going to look at 3 forms of cancer. So we're going to look at liver, we're going to look at stomach cancer, and colorectal cancer as well. So I'm looking forward to see you next week. Thank you so much.